She grabbed the defibrillator before anyone could stop her. The patient was blue. The monitor was screaming. And every doctor in that room was frozen, except the nurse they'd been laughing at all week. One charge, 200 joules. The body arched off the table, then dropped. Silence. Then a single beep, then another. The flatline became a rhythm, ragged but real, and Mara Bennett stepped back from the bed like she'd done this 1,000 times before because she had. Chief Surgeon Victor Hale stood in the doorway with his mouth open and nothing to say. If this story already has you on the edge of your seat, you're exactly where I want you. Follow along to the very end and drop a comment telling me what city or country you're watching from. I want to see how far this story can travel. The shift started the way most of Mara's shifts started at Redwood Valley Medical Center, with someone talking about her like she wasn't in the room. "Bennett's on nights again," said Dr. Carla Voss, not bothering to lower her voice as she signed off at the nursing station. She was a second-year surgical resident, 28 years old, and already carrying herself like she'd invented suturing. "Someone remind me why we keep scheduling her on trauma nights." The charge nurse on duty, a tall woman named Brenda Okafor, laughed once through her nose. "Administration loves the numbers. She shows up, never calls in sick, doesn't complain. Cheaper than hiring someone competent." Mara was 12 feet away, updating a medication chart. She didn't look up. She'd learned not to. That was the rhythm of this place. Redwood Valley Medical Center sat in the western edge of Boise, Idaho, a mid-sized regional hospital that handled everything from agricultural accidents to cardiac events to the occasional hunting injury brought down from the foothills. It wasn't a trauma center by designation, but it handled enough emergencies that it functioned like one on weekends and holidays. The staff was stretched. The politics were thick. And at the center of all of it was Dr. Victor Hale, chief of surgery, a man who ran his department like a fiefdom and treated anyone below him on the org chart like furniture. Hale was 53, broad-shouldered in the way of someone who'd played college football and never quite let go of that identity. He wore his salt and pepper hair clipped close and his confidence like body armor. In meetings, he was brilliant and charming. In the halls, he was something else. He had a specific kind of contempt for nurses, the sort that wasn't explosive or cruel enough to get HR involved, just a constant low-grade dismissal. An interruption here. A correction that wasn't necessary there. A look that said, "You're not worth explaining this to." He'd turned that look on Mara Bennett approximately 3 weeks after she'd started at Redwood Valley, 8 months ago. She'd flagged a medication error on a post-op patient, a dosage of heparin, that at the prescribed rate would have caused a bleed event within 6 hours. She'd brought it to the attending quietly, by chart note, the way she'd been taught. The attending had fixed it without comment. Hale had found out. Instead of a thank you, he'd pulled her into the hallway and told her, in a voice like smooth gravel, that nurses at this hospital did not second-guess physician orders without running it up the chain first. "You don't like our process," he'd said. "You can find somewhere else to apply your considerable expertise." She hadn't answered him, just looked at him, then walked back to her station. That look, the steadiness of it had bothered him since. She could tell. He made a point of reviewing any chart she'd touched, of questioning her assessments in front of the team, of finding small procedural issues that weren't really issues and escalating them to the nursing director. None of it stuck. Her documentation was immaculate. Her patient outcomes were clean. Her incident rate was 0, which in its own way seemed to irritate him more. Tonight was a Thursday in late October, the air outside already carrying the first real bite of winter. The ER was moderately busy, a suspected appendicitis in Bay 3, a teenage boy with a broken wrist from a skateboard fall, a woman in her 60s showing early signs of a cardiac event that was still being evaluated. Mara was assigned to the medical surgical floor, one level up, covering 6 patients through the night. It was supposed to be quiet. She was redressing a wound on a 67-year-old man named Gerald Putnam post-op from a hip replacement, grumbling cheerfully about the hospital food when the overhead PA cracked to life and called a rapid response to room 412. Mara stripped her gloves, told Putnam she'd be back, and moved. Room 412 was 3 doors down. She pushed through the door to find a scene that was already tilting toward disaster. The patient was a 44-year-old man named Dennis Farrow, admitted 2 days ago for a monitoring workup after a stress test had flagged an arrhythmia. He was scheduled for further imaging in the morning. He was also at this moment completely unresponsive, his color a shade between gray and blue, and the monitor above his bed showing a ventricular fibrillation pattern that anyone with basic training would recognize. The nurse who'd called the code was standing at the foot of the bed looking pale. A second nurse was on the phone, presumably calling down to the ER for a physician. A third person, an aide, had already started toward the crash cart. Mara crossed to the cart, pulled out the defibrillator paddles, and pressed them against the gel pads she'd already placed on Pharaoh's chest with her other hand before anyone registered she'd moved. "Charging," she said. "Wait," the first nurse started. Clear, Mara's voice was flat. Not loud, not urgent. Just certain. She delivered the shock. Pharaoh's body arched, dropped. The monitor screamed its flat tone for 1 second. 2 then stuttered into a jagged but rhythmic pattern. Sinus rhythm, not perfect, but recoverable. Mara set the paddles aside, checked his pulse manually at the carotid, then moved to the IV line to confirm access. That was the moment Dr. Hale walked in. He'd been on the floor for a late consult on the appendicitis case downstairs and had heard the overhead call. He stood in the doorway of room 412 in his white coat, taking in the scene, Pharaoh breathing shallowly on the bed, the monitor now showing organized rhythm, Mara Bennett pulling a syringe from the crash cart with the same expression she used when she was filling out paperwork. "What happened?" he said. "Not quite a question." "VFib," Mara said without looking at him. Single shock converted him. He needs a 12 lid now and cardiology on the phone. Hale walked to the bedside, checked the monitor himself, then looked at her. "You shocked this patient before a physician arrived." "Yes, you're a floor nurse, Bennett." He was in VFib. There wasn't time. Hale looked at the other nurses in the room. They weren't meeting his eyes. He looked back at Mara. "We'll discuss your scope of practice in the morning." "Sure," she said. She was already documenting the event time on the paper strip from the monitor, her handwriting precise and even. You'll want to note that the shock was delivered at 21:14, rhythm converted by 21:15, 12 lead was obtained at 21:18. All times logged. Hale said nothing, but she could feel the particular quality of his silence, not anger exactly, not yet, but something more unsettling. A man recalibrating, he ordered the 12 lead. He called cardiology. He stood at the foot of Dennis Pharaoh's bed, while the patient, now semi-conscious, began to look around the room with the confused relief of someone who'd been somewhere else and come back. And when Pharaoh's hand found Mara's wrist and he said, barely audible, "Thank you," Hale turned and walked out without a word. The morning after, the conversation with nursing director Patrice Doyle lasted 20 minutes. Mara sat in the small office off the administrative wing, in a chair that was slightly lower than Patrice's, which she suspected was intentional, and listened while Patrice explained the hospital's rapid response protocol in careful, bureaucratic language that was really just a way of saying you overstepped. "We're not questioning your instincts," Patrice said, folding her hands on the desk. She was in her 50s, well-organized, not unkind, but also very clearly protecting the institution rather than the person in front of her. "But our protocols exist for reasons. Defibrillation by nursing staff without direct physician oversight creates liability." "He'd have been brain dead in another 30 seconds, Mara said. "That's not the point, I know." "The point is procedure, Mara." "Procedure," Mara said, and left it there. Patrice made a note, reminded her that a formal write-up would be placed in her file standard for any deviation from protocol, and sent her back to work. Hale had not apparently recommended termination. That surprised her slightly. But she suspected it wasn't generosity. It was something more practical. Terminating someone who'd just saved a patient's life was a public relations problem. Better to document, contain, and slowly make the position uncomfortable enough that she left on her own. She'd seen the strategy before. That afternoon, she was assigned to transport duty, escorting discharged patients to the lobby, which was technically within her job description, and also the clearest possible message about where she currently stood. She did it without comment. She helped an elderly woman named Dolores Reyes into a wheelchair and pushed her to the front entrance, listening to Dolores talk about her grandchildren, and thought about nothing in particular. What she didn't do was tell Patrice or Hale or anyone else at Redwood Valley Medical Center that she held an active medical license in the state of Idaho, not as a registered nurse, but as a physician. She didn't mention her surgical residency, completed in under 3 years. She didn't mention the 7 years afterward, the deployments she couldn't name to locations she couldn't disclose, the operating environments that made this hospital's trauma bay look like a simulation. She didn't mention the cases, the outcomes, the decisions made in places where there was no one to call, no protocol to follow, and no margin for anything except getting it right. She'd come to Redwood Valley because she needed quiet, because quiet was, at this particular point in her life, the only thing that felt survivable. She pushed Dolores Reyes through the automatic doors and into the pale October sunshine and thought about nothing in particular. The hospital's administrative structure had, at its center, a man named Gerald Ashworth, who held the title of Chief Operating Officer and functioned as the practical authority over everything that wasn't strictly clinical. He was 57, methodical, and had spent 30 years in hospital administration. He was not by nature a curious man, but he was a thorough one. The write-up from Patrice Doyle crossed his desk the following morning. He read it twice. He pulled Mara Bennett's personnel file. The file was thin. Not thin in the way of someone who'd recently been hired, thin in the way of a document that had been trimmed. Her nursing credentials were valid, her references were clean but sparse. Her employment history showed a gap of several years with a notation that said simply, "Prior employment federal contractor. Details not available for disclosure." Her background check had cleared. Her fingerprints had returned clean. There was no red flag, technically. But Ashworth had been in hospital administration for 30 years, and he knew what a normal nursing file looked like. This wasn't one. A woman in her late 30s with her level of clinical precision, the kind that made experienced physicians stop and pay attention, didn't come out of a nursing program and a few years of contract work. There was too much confidence in her movement, too much economy in her technique. She didn't second-guess herself. She didn't defer. She just did. He sent a routine inquiry to the credentialing office, asking them to run an expanded background verification on Bennett, and then set the file aside. He had a budget meeting in 20 minutes. The credentialing response came back the following afternoon, and it said, in so many words, that the expanded verification had been flagged at the federal level and that further inquiry should be routed through the appropriate government channels. Ashworth read that twice, too. Then he put the file in his desk drawer and locked it. 3 days passed. Mara worked her shifts. She kept her head down, her documentation clean, and her interactions with Hale minimal. He had taken to assigning her to the floor's lowest acuity patients, the recoveries, the discharges, the routine monitoring cases. She understood what he was doing. She did the work with the same attention she gave everything else. Brenda Okafor had stopped laughing at her, at least, which was something. She hadn't apologized, but she'd started looking away when Mara passed instead of through her, which was its own kind of acknowledgement. On the fourth day, the weather shifted. A cold front had been sitting over the foothills for 48 hours, and when it finally moved south and east, it brought with it a hard freezing rain that turned the interstate into something dangerous by mid-morning. The first accident call came into the ER at 11:47. By noon, the hospital had 3 vehicles involved. By 12:30, they had 7, and the word coming from the paramedic radio was that it wasn't over. Mara was eating lunch in the break room when the trauma activation alert went out over the overhead. She didn't hesitate. She put down the half-eaten sandwich, pulled her hair back, and walked to the stairs. The trauma bay was already controlled chaos when she arrived. Hale was there, and 2 of his residents, and the ER attending doctor. Marcus Wren, who was managing the less critical cases, with the efficiency of someone who'd done this before. There were 3 patients incoming simultaneously, a miracle of triage from the paramedics on scene. The first 2 arrived within 60 seconds of each other. A woman with a head laceration and suspected spinal involvement, and a teenage boy with significant thoracic bruising and possible rib fractures. Both serious, neither immediately dying. Hale took charge, distributed the residents, and the bay functioned roughly the way it was supposed to. The third patient arrived 4 minutes later, and the bay went quiet in a particular way, the kind of quiet that happens when experienced medical people see something that is very, very wrong. His name, according to the paramedic who was pushing the gurney and talking fast, was Raymond Kowalski, 49 years old, driver of one of the vehicles. The car had been T-boned on the driver's side at speed. He'd been partially ejected. His left thigh had an improvised tourniquet applied in the field, a paramedic belt cinched hard enough to leave marks, and beneath it the dressing was soaked through, the color already wrong, the rate of saturation suggesting a loss that had not been contained. His color was the gray-yellow of significant blood loss. His pressure, the paramedic was saying, was dropping, had been dropping since pickup. Femoral, Mara said, from the edge of the bay, where she'd positioned herself to stay out of the way. She said it quietly to herself as much as anyone. One of the residents looked at her. "What? The bleed is femoral." She moved closer, her eyes on the leg. "The tourniquet position is wrong. It's distal to the wound. Pressure's not being applied to the vessel." She looked at the paramedic. "When did you place this?" 12 minutes ago, which meant approximately another 12 minutes of arterial bleeding at or near full rate, because the tourniquet was doing partial work at best. and arterial bleeding from a femoral laceration at full rate was a timeline measured in minutes. She looked at Hale. He was looking at the patient, and then at the monitor as the tech attached leads, and she could see him running calculations, not wrong ones, but slow ones. "Dr. Hale," she said, "he needs the tourniquet repositioned and vascular access in the next 2 minutes, or—" "I'm aware, Bennett." His voice was sharp. "Step back." She stepped back. She watched him direct the resident to reapply the tourniquet, watched the resident try once, the angle wrong, the patient beginning to move despite the cervical collar. The monitor showed a heart rate climbing, pressure dropping, the arithmetic of hemorrhagic shock writing itself in numbers on the screen. Kowalski's head turned toward her. His eyes were tracking barely, but they found her face. He didn't speak. He didn't need to. Mara stepped forward. "Excuse me," she said to the resident, and moved him aside with her shoulder before he could object. She repositioned the tourniquet in 2 motions, tightened it to the correct anatomical point, and felt the immediate change in tension. She pulled on gloves already gloved. She'd done it on the way in, and pressed her fingers to the wound through the dressing, found the pressure point, applied direct compression while saying to the nearest tech, 2 large bore IVs, antecubital and right forearm, warm saline now. Bennett, Hale's voice had a different quality now. "You will step away from my patient when he's stable," she said. She didn't look up. "This is not a negotiation. His pressure is 62 systolic," she said. "At this rate, he has 4 minutes before he loses consciousness, and maybe 8 before his heart stops. You can finish this conversation after." The room had gone very still. Not the chaotic stillness of crisis, but the particular stillness of people watching something they couldn't categorize. Hale stood 2 feet from her, and the thing on his face wasn't anger anymore. It was something more complicated. Kowalski's pressure read 60 on the next cycle, then 63, then slowly 68 as the IVs went in and the fluid started, and the hemorrhage under controlled compression began to respond. "He needs ore," Mara said, still not looking at Hale. "Vascular repair of the femoral, probably a partial transection. He needs blood now, not saline, and he needs surgery in the next 20 minutes. "I know what he needs," Hale said. "Then let's get him there." The look Hale gave her, it lasted maybe 2 seconds. Then he turned to his resident and started giving orders, exactly the orders she'd described, in a tone that made it sound like the plan had always been his. She moved aside without comment. She watched the team stabilize the patient for transport, confirmed the blood products was ordered, confirmed the OR was being prepped. Kowalski was moved to surgery 11 minutes later. His pressure was 79 by then, still dangerous, but workable, still alive. Mara stripped her gloves, washed her hands at the bay sink, and went back to the medical surgical floor without speaking to anyone. She didn't learn until later what had happened in the administrative offices that afternoon, while she'd been finishing her shift. She learned it in pieces, from different people, over the following day. Ashworth had been watching the security footage from the trauma bay. Not for any particular reason. There was a liability review process that involved regular footage audits, and the mass casualty event triggered an automatic review pull. He'd watched the footage twice. He'd then called Patrice Doyle. Patrice had then called Hale. The conversation between Hale and Patrice, according to 2 nurses who'd been nearby, had been sharp. The word termination had been used. So had the word board. Hale had come out of Patrice's office, looking like a man who'd received information he didn't know what to do with, not angry, exactly. More like rearranging. The following morning, Mara arrived for her shift and found her access badge wasn't scanning. She went to the nursing station. Brenda Okafor was behind the desk and didn't quite meet her eyes. "Administration wants to see you," Brenda said, "before you clock in." Ashworth's office was on the 3rd floor. He asked her to sit down. He had a folder on his desk that she recognized as her own personnel file. He looked at her for a moment before he spoke. "Your background verification," he said, "came back with a federal access flag. Do you know what that means?" "It means the records are restricted," she said. "It means your records essentially don't exist in any form I can access." He leaned back. "I've been doing this 30 years, Ms. Bennett. I've never seen that on a nursing file." She said nothing. "Dr. Hale has recommended your suspension pending a scope of practice review. Given what the trauma footage shows, I'm inclined to handle this differently. But I need to understand who I'm dealing with." He opened the folder. "This file tells me almost nothing." "I know," she said. "Is there something you'd like to tell me?" She looked at him. He was a reasonable man, she thought. Not courageous, maybe, but reasonable. He wanted to do the right thing, or at least the defensible thing, which wasn't exactly the same but was close enough in most situations. "Not yet," she said. He held her gaze. Your access badge has been temporarily suspended. You're on administrative leave. Paid pending review. That's standard, I understand. Do you have a response to Dr. Hale's complaint? I saved the patient, yes. Ashworth closed the folder. You did. She stood, thanked him, and walked out of his office. In the elevator down, she pressed the button for the lobby and stood with her hands at her sides and thought about the arithmetic of the situation. She'd known, when she'd stepped forward in that trauma bay, what it would cost. She'd done it anyway because the alternative was watching a man bleed to death by degrees, while the people responsible for his care moved at the wrong speed for the wrong reasons. Some calculations were simple. Others just looked that way. She was crossing the lobby toward the exit when the glass doors at the front of the hospital slid open and a woman in came running in from the parking lot, nearly colliding with her. The woman was one of the ER nurses. Mara recognized her. Early 20s, name was Jess, and her face was the specific expression of someone who'd been outside when something happened overhead. Did you hear that? Jess said, breathless, looking up at the lobby ceiling like she could see through it. Mara stopped. She'd heard something, actually. She'd been trying to identify it without consciously thinking about it, a low rhythmic thudding, mechanical, growing louder by the second, coming from somewhere above the building and to the north. She knew that sound. She'd spent years under it. She'd worked beneath it in places without names, in conditions without precedent, and the thing it meant had never once been peaceful. The hospital skylight above the lobby showed a gray October sky. Then something moved across it, a shadow, a shape, blocky and heavy and unmistakable, and the thudding became a roar that the walls couldn't contain, shaking the glass in the lobby doors, rattling the keys on the nursing station counter 30 feet away. A Black Hawk helicopter settled onto the rooftop landing pad above them with the particular authority of something that did not ask permission to land. Mara stood very still in the lobby of Redwood Valley Medical Center with her suspended access badge in her hand, and she listened to the rotors, cut from a scream to a whine to a slow, deliberate silence, and she knew, with the certainty of someone who had spent 7 years learning what it meant when the military came to find you, that this was not a routine medevac. They had come for her. The rotors had gone quiet, but the silence they left behind was louder than anything. Mara didn't move. She stood in the lobby with the suspended badge hanging from 2 fingers, watching the ceiling like she'd see through the concrete and steel to whatever had just landed on the roof above her. Around her, the lobby had turned into a still photograph, the receptionist frozen at her desk. Jess, the ER nurse, stopped mid-step, a man in a visitor's pass lanyard holding a paper coffee cup that was tipping slowly towards spilling and not noticing. Then the stairwell door at the far end of the lobby banged open. They came through in a column, 4 of them in multicam fatigues, body armor, no weapons drawn but hands loose and ready, moving with the compressed efficiency of people who'd cleared rooms in places that didn't make the news. Behind them, a 5th man, taller than the others, no helmet, short-cropped silver hair, a colonel's eagle on his chest, and the kind of posture that had never once in its life been tired. He stopped in the center of the lobby and looked at Mara like he'd known exactly where she'd be standing. Major Bennett, he said. His voice was not loud. It didn't need to be. The coffee cup hit the floor. Nobody moved to clean it up. Mara looked at Colonel Ethan Rourke because of course it was Rourke. Of course, out of everyone they could have sent it, was the one man she'd never managed to argue out of anything, and felt something cold settle in her chest. Not fear. Something older than fear. The particular weight of a past that had decided it wasn't done with you yet. You have terrible timing, she said. I know. He crossed the lobby toward her. We need to talk. I'm on administrative leave. I'm aware. He stopped 3 feet away and looked at her the way he always had, straight on, nothing softened, no apology in it. We have a situation. I don't have a situation anymore. I left. The situation doesn't know that. Before she could answer, the stairwell door opened again. 2 more soldiers, and between them a gurney, not a hospital gurney. A military litter with field-modified rails, moving fast, pushed by hands that knew how to move a casualty without jostling the injury. On it was a man, large, the build of someone who'd spent years underweight. His face was pale in the specific drained way of someone who'd lost blood faster than it could be replaced, and the field dressing on his torso, done by someone competent, Mara registered automatically, but done under conditions where competent had limits, was soaked through in a pattern that told her things before she consciously formed the thought. She moved before Rourke finished his next sentence. She was at the litter in 4 steps, gloved from the kit one of the soldiers handed her without being asked, her fingers already checking pulse at the neck, because the wrist would tell her less. 62 beats per minute, 30. The quality of a heart working too hard on too little. What's the injury, she said. Aortic, Rourke said behind her. Thoracic or abdominal? They think thoracic. Descending. She pulled the field dressing back, 2 centimeters enough to see, not enough to compromise the compression, and looked at what was underneath. The wound was a penetrating trauma, left thorax, roughly 4th intercostal space, and whoever had packed it in the field had done it correctly. But packing bought time, not solutions. A thoracic aortic injury was not a waiting problem. How long ago? 80 minutes from initial injury. 40 from field stabilization. 80 minutes. She ran the math she didn't want to run. Descending thoracic aorta, contained by the packing and whatever anatomical grace had kept the hematoma from rupturing. But that containment was a negotiation with physics that was currently losing. He needs an OR, she said, now. Not a trauma bay, an OR. Full vascular setup, cell saver, at least 4 units of ONEG on the table before we start. That's why we're here, Rourke said. She looked up at him. I'm a nurse at this hospital. As of an hour ago, a suspended nurse. You're Major Mara Bennett, and you are the only vascular surgeon within 300 miles who has operated on a descending thoracic aortic injury in a non-controlled environment and kept the patient alive. He held her gaze. I need your hands, Major, not your employment status. The lobby had not moved. The receptionist was staring. Jess was staring. 2 orderlies who'd come through from the ER wing had stopped in the doorway. Every person in that space was watching a woman in nursing scrubs get called major by a colonel in combat gear, and the information was not computing in real time. Mara looked at the man on the litter. He was conscious. Just barely his eyes were open and tracking her face, and there was something in them that wasn't quite fear and wasn't quite trust. Just the raw animal focus of a person who understood that they were close to dying and was watching the nearest person who might stop it. She'd seen that look before. More times than she'd ever wanted to count. Get him upstairs, she said. Trauma 2, not one better OR access from the elevator bay. She was already moving toward the nurse's station. Someone get me Patrice Doyle and whoever is covering anesthesia right now. The news traveled through Redwood Valley Medical Center the way hospital news always did, faster than the PA system. Slower than the actual emergency. By the time Mara was on the 2nd floor and moving toward the surgical suite with Rourke's team behind her, she could feel the shift in the building. People stepping out of doorways. Heads turning in corridors. The specific energy of an institution processing something it didn't have a category for. Dr. Victor Hale was waiting at the entrance to the surgical wing. He'd been paged by Patrice, who'd been trying to reach Ashworth, and the chain of communication had deposited him here, looking like a man who'd been interrupted in the middle of winning something. He took in the soldiers. The gurney. Mara at the front of it in her scrubs with a colonel beside her. The gurney moving at a pace that didn't suggest anything optional. What the hell is happening, Hale said. Not to anyone specific. Trauma incoming, Mara said, not slowing down, penetrating thoracic injury. I need OR 2 cleared and prepped. You are on administrative leave, Hale said. He stepped partially into the path of the gurney. You don't have surgical privileges at this. Move, please. Her voice was flat. I will not move, Bennett. You do not have the authority to... Rourke stepped forward. He placed himself between Hale and the gurney, with the deliberate calm of someone who dealt with far more dangerous obstructions than a hospital administrator with opinions, and he looked at Hale with an expression that was almost polite. Colonel Ethan Rourke, Special Operations Command, he said. That patient is a United States Special Operations soldier on active duty, operating under federal medical jurisdiction. The surgeon directing his care has been confirmed under federal authority. If you obstruct his treatment, I will have you removed from this floor. The almost politeness didn't waver. That's not a request, doctor. That's a notification. Hale looked at Rourke. He looked at the soldiers. He looked at the gurney, now being pushed past him by 2 of Rourke's team, while the 3rd held the elevator. He looked at Mara last. She met his eyes for exactly 1 second, not with satisfaction, not with anger, just the level look she'd given him that first day in the hallway when he'd told her to find somewhere else to apply her expertise, and then she walked past him into the surgical wing. The scrub nurse assigned to OR 2 was a woman named Tessa Falk, 18 years in surgical nursing, and she had the particular gift of being unflappable in conditions that flapped everyone else. She looked at Mara, looked at the gurney, looked at the soldiers standing in the corridor, and then looked back at Mara. Do you need me to call someone? Tessa asked. I need you to scrub in, Mara said. Are you comfortable with that? Tessa considered this for approximately 2 seconds. What's the injury? Descending thoracic aorta. Penetrating, partially contained. I'm going to open the left chest, get eyes on the injury, and make a call from there. Could be a direct repair, could be a graft. I won't know until I'm in. I've got you, Tessa said. She turned toward the instrument room. The anesthesiologist on call was a compact, careful man named Dr. Soren Veld, who arrived in the OR looking like he'd run from wherever he'd been, and was already reviewing the field notes Rourke's medic had handed him. Veld was not the kind of person who needed the situation explained twice. He read, processed, and started preparing his lines without commentary. The patient, Sergeant First Class Dean Ferris, Mara learned from the field tag on his litter. 29 years old, blood type O positive, no known allergies. Next of kin notified was transferred to the OR table with the careful coordination of Tessa, the two soldiers, and a circulating nurse who had appeared from somewhere and was doing her job without being asked if she was comfortable doing it. Mara washed her hands at the OR sink. The ritual of it, water temperature, brush on skin, timed, methodical, was the same ritual it had been in places far removed from this tiled room in Boise, Idaho. Her hands didn't shake. They hadn't shaken in years. She wasn't sure whether that was a good thing or not, but it was reliable. Tessa helped her gown. Gloves snapped into place. She turned to the table. Soren, she said, when you're ready. Veld's voice came from behind the drape. 2 minutes. She looked at Ferris. His eyes were still open, the anesthesia not yet placed. He was watching her with that same focused attention she'd noticed in the lobby. Up close, she could see that he was young in a way that the situation made easy to miss early lines around his eyes, from squinting into sun and wind, the particular weathered calm of someone who'd been trained out of panic, but underneath it the face of someone who was 29 years old and a long way from anywhere familiar. You're going to be okay, she said. She said it the way she always had, in the years before this, not as a promise, because she'd learned not to make those, but as a statement of intention, what she was going to do, what she was working toward. He blinked once. Slow, something in his face settled. Veld put him under 90 seconds later, and Mara went to work. Outside the OR, the surgical wing had become its own controlled chaos. Hale had not left the floor. He'd retreated to the far end of the corridor, where he was making phone calls with the focused intensity of someone building a case in real time. Rourke had placed one of his soldiers at the OR door, not blocking it, just present, which was its own kind of statement, and was standing near the nursing station reviewing the field medic's notes. Patrice Doyle arrived on the floor at a near run, took in the soldiers, the activity, and the fact that Hale was standing 12 feet away making phone calls rather than doing anything clinically useful, and then found Rourke. I need to understand what's happening on my floor, she said. She had the voice of someone accustomed to being answered. Rourke gave her the short version. Injured soldier, federal jurisdiction, confirmed surgeon. He kept it factual and brief and left no space for argument. Patrice listened. Then what is her actual title? Bennett's. Major, United States Army. She was attached to a classified surgical unit for 7 years. Her military record is sealed, but her medical credentials are not. She holds an active, unrestricted medical license in the state of Idaho. He paused. She's been working as a floor nurse here for 8 months. Patrice stood very still. She's a physician. She's a trauma surgeon, Rourke said. Vascular specialty. Patrice looked toward the OR doors. Then she looked at Hale, who was still on his phone. Something moved across her face, not quite guilt, not quite anger. Something that was working out the arithmetic of what had been done in this building over the past 8 months. He put her on transport duty, Patrice said. More to herself than to Rourke. I know. He wrote her up for saving a patient. Rourke said nothing. Patrice was quiet for a moment. What does she need? She has what she needs, Rourke said. Right now she just needs no one to interfere. Inside OR 2, the interference was coming from the injury itself. Mara had opened the left chest along the posterolateral line, a thoracotomy she'd performed enough times that the incision was clean before the thought finished forming, and what she found when she got through was slightly worse than the field notes had suggested. The hematoma around the descending thoracic aorta was larger than expected, not yet ruptured, but under enough pressure that it was a question of minutes, not the comfortable buffer she'd hoped for. The penetrating fragment had nicked the vessel wall in 2 places, neither catastrophic alone but together, and under the pressure of a functioning circulatory system, they were a compounding problem. Clamp, she said. Tessa placed it in her hand without the half-second delay that came from hesitation. Mara appreciated that more than she'd say. She placed the proximal clamp above the injury, working in the narrow space between the aorta and the esophagus with the kind of focused precision that looked, to anyone watching, like calm. It was not calm, It was the precise application of training to a situation where calm was irrelevant. What mattered was accuracy, speed, and the discipline not to hurry past the point where hurrying made things worse. The clamp seated. She felt the change in pressure through her hands. Distal, second clamp below the injury. Ferris's pressure dropped because it would proximal aortic clamping reduced flow to the lower body. And that was a clock, and she knew it, and so did Veld, who was already adjusting from his side of the drape and talking in the low, continuous way of an anesthesiologist monitoring a crisis in real time. He's tolerating it, Veld said. Pressure's down, but holding. Don't rush. I know, she said. The first laceration was accessible from the approach she had. She repaired it with a 4-0 Prolene suture in a running stitch, the needle moving in the rhythm she'd established years ago in environments where the next supply run was uncertain, and you used what you had with complete commitment. Steady, precise. Not fast was for the parts where speed was the answer. This was not one of those parts. The second laceration was harder to reach. It was posterior, partially behind the spine's curvature, and the angle required her to shift position and ask Tessa to adjust the retractor in a way that required both of them to understand without much conversation what was needed and where. Tessa did. Mara adjusted. The needle found its angle. She was halfway through the second repair when Ferris's blood pressure took a sudden drop, not the expected drop of clamping, but a new one, steep and fast. What happened? She said. Veld's voice came back immediately. I'm not sure. His venous pressure just spiked, said the circulating nurse who was watching the secondary monitors. Mara ran the possibilities in approximately 1 second. The clamp was seated. The repair was progressing. The bleeding she could see had been controlled, which meant the problem was somewhere she couldn't see. She looked at the chest cavity with fresh eyes and found it pooling blood behind the left lower lobe, the kind that happened when a secondary vessel, smaller than the primary injury but not minor, had been shaken loose by the impact or the manipulation, and was now contributing to the problem. She reached for the suction. Tessa, second retractor, right side. Got it. She suctioned, found the vessel a bronchial artery, mid-size, torn at its origin, and clamped it before it became worse. The suction pulled 60 milliliters of accumulated blood and cleared her field. Veld called out the pressure improving, slowly, the numbers climbing back toward something workable. The rest of the repair was not easy. It was just the kind of difficult that she'd been trained to manage, which was different from easy in ways that only made sense from the inside. The graft was placed. The sutures were tied. The clamps came off in sequence, distal first, then proximal, and the aorta filled and the perfusion returned, and Ferris's pressure stabilized at a number that Veld called, in a tone that, for an anesthesiologist, constituted genuine relief. Mara closed the chest in layers, methodical and thorough, and didn't speak except to request instruments and confirm counts. When the last stitch was placed, and Tessa confirmed the count closed, she stepped back from the table and stripped her gloves and stood for a moment with her hands at her sides. Tessa was watching her from across the table. Good surgery, she said. Mara nodded once. Good assist. She went to the sink and ran cold water over her hands and thought about nothing deliberate for 30 seconds. Just water and cold and the mechanical unwinding of the last 2 hours. Then she dried her hands and walked out of the OR. The corridor outside had changed while she was inside. Rourke was still there, but he'd been joined by Ashworth, who was standing with his arms at his sides, and the expression of a man revising every assumption he'd organized his morning around. Patrice was nearby. 3 of the floor nurses had found reasons to be in the corridor. Hale was gone from the far end. His absence had a specific quality to it, like a storm that had moved but not dissipated. Rourke looked at her face, not asking the question out loud. He's alive, she said. Stable. He'll need monitoring for the next 12 hours, but the repair is solid. Veld will manage post-op. Rourke closed his eyes for approximately 1 second, opened them. Thank you, Major. Don't, she said, not harshly, just tired. Ashworth stepped forward. He looked at her, with the expression she'd seen in his office, the man trying to do the defensible thing, which was still closer to the right thing than most people managed. Ms. Bennett, Major, I owe you an explanation, and also probably an apology. You don't, she said. You did what made sense with the information you had. We suspended your access this morning. Yes. You came back anyway. She looked at him. There was a patient. Ashworth was quiet for a moment. Then, what do you need from us right now? She thought about it. She was tired in a way that went past physical, the kind of tired that came from pretending to be smaller than you were for long enough that the pretending had become its own kind of work. She was also underneath the tired something else. something she hadn't felt in a long time and didn't have a clean name for. "I need to know," she said, "where Dr. Hale went." No one in the corridor answered immediately. It was Brenda Okafor who had appeared at the edge of the nursing station and was watching Mara with an expression of 3/4 remorse and 1/4, something still figuring itself out, who finally said, quietly, "He went to administration. He's been on the phone with the hospital's legal counsel for the last 40 minutes. Mara absorbed this. She looked at Rourke. "His complaint is going to be that I performed surgery without hospital privileges." "It won't hold," Rourke said. "Federal medical authority supersedes." "I know it won't hold legally," she said. "That's not what I'm talking about." She looked back at the OR doors, where through the small window she could see Tessa and the circulating nurse completing the final steps of the close. "He's going to say the soldier's outcome would have been the same under his care. He's going to say I interfered. And some version of that will stick somewhere, with someone, because that's how this works." "Not if the record says otherwise," Rourke said. He was watching her with the particular attention of someone who'd worked alongside her, long enough to know what she was doing, not arguing, not resigning, thinking. "And the record says otherwise." She looked at him. "What did you bring with you, besides the patient?" Rourke reached inside his jacket. He pulled out a folded document, actual paper, which meant it had been prepared in advance, which meant this visit was not entirely the improvised response to a crisis it had appeared to be, and held it out to her. She took it, unfolded it, read it. It was an official commendation letter, dated 6 months ago, signed by people whose signatures she recognized and hadn't seen in years. It was addressed to the commanding general of the relevant command, but attached to it was a secondary document, a formal verification of credentials, her surgical training, her deployment record in the categories that were unclassified, and a summary of her medical accomplishments that was careful and factual and devastating in its specificity. She folded it back up. "You brought this in case I needed it," she said. "I brought it because you'd need it eventually," he said. "I was hoping you'd have let me give it to you before today." She looked at him for a long moment. Outside the OR, somewhere below in the hospital, she could hear the faint sound of a phone ringing and not being answered. She could hear the building adjusting around the afternoon, the slow institutional inhale of a place processing what had just happened inside its walls. She was still holding the document when the door at the far end of the corridor opened and Victor Hale walked back onto the surgical floor. He'd collected himself. His white coat was straight. His expression was the one he used in meetings controlled, authoritative, a man entering a room he believed he owned. Behind him was a woman in a gray suit, who had the look of hospital legal counsel, prepared, careful, here to manage. He stopped when he saw Mara standing in the middle of the corridor with a colonel on one side and Rourke's document in her hand, and he didn't say anything for a moment. He looked at Ashworth, at Patrice, at the nurses behind the station who were watching him with expressions that had stopped being deferential somewhere in the last 2 hours. Then he looked at Mara. "This hospital," he said, choosing his words the way a man chose his footing on uncertain ground, "cannot simply allow unauthorized individuals to perform major surgery on its premises, regardless of whatever federal." His aorta was going to rupture in 8 minutes, Mara said. "That's a clinical judgment that should have been made by the attending physician." "You were in the corridor," she said. "You were in the corridor making phone calls." The hallway went quiet. Not the ambient quiet of a functioning hospital, but the particular silence of a group of people watching something true being said out loud. Hale's jaw tightened. "I was addressing an institutional concern. Dean Ferris is 29 years old," Mara said. "He went into the OR with a contained thoracic aortic injury that was going to stop being contained in approximately 8 to 12 minutes. He's alive right now because someone was in that room making decisions instead of managing institutional concerns in the hallway." The woman in the gray suit touched Hale's arm. Something passed between them, not words, just the practiced silent communication of a client being reminded to stop talking. Hale stopped talking. Mara looked at him. She'd spent 8 months being talked over, written up, assigned to transport duty, and called incompetent in voices that didn't bother to lower themselves, and she felt none of the satisfaction she'd once imagined she might feel in a moment like this. Just the same flat steadiness, the same calculation running underneath. She looked at Ashworth. "I want to see my employment file," she said. "Everything in it." Tonight, Ashworth nodded slowly. "I'll have it ready." Rourke said nothing, but she could feel him beside her, not pushing, not managing, just present. He'd always been good at that, knowing when to be the weight in the room and when to let someone else carry it. She turned back toward the OR doors. Through the window, Tessa had finished. The circulating nurse was making notes. Dean Ferris, 29 years old soldier, was breathing on his own under monitored anesthesia, his repaired aorta holding, his blood pressure climbing back toward a number that meant he would wake up. But behind her, she could hear Hale's voice again, lower now, directed at his legal counsel, controlled and strategic, and already reframing the afternoon into something with different edges. She could hear the particular cadence of a man who had decided that the version of events he told was the version that would matter. And she understood, standing there with Rourke's document in her hand, and 8 months of this building's institutional memory pressed against her back, that the fight that was coming was not going to be the surgical kind. It was going to be the kind that happened in files and meetings, and the carefully worded language of official complaints, and it was going to require a different set of instruments than the ones she'd just put down. She turned one more time, not toward Hale, toward Brenda Okafor, who was standing at the nursing station looking like a woman who'd been carrying something and had just realized she was allowed to put it down. Mara looked at her steadily. "I need everything," she said. "Every incident report, every note, every complaint he filed against me, every deviation he logged, all of it." Brenda blinked. "I don't have access to." "You know who does," Mara said. A beat. Then Brenda straightened. "Yeah," she said quietly. "I do." Mara nodded once and turned away. She was halfway down the corridor when she heard it, a voice. Hale's, sharp with the edges he usually kept smoothed down, carrying from the doorway where he was still talking to his counsel. She caught only a fragment, 4 words that cut through the ambient hospital noise, with the clarity of something said without enough care. "Before she disappears again." She didn't slow down. She kept walking, the document in her hand, Rourke's footsteps falling in beside her, the OR behind her, the administrative floor 2 levels below, and somewhere in the building the evidence of 8 months of deliberate, systematic erasure waiting to be looked at in the right light. Hale thought this was about her disappearing. He'd spent 8 months believing she was something temporary, a misplaced body, an inconvenient file, a problem that would eventually resolve itself by leaving. He had not yet understood that everything she needed to end this was already here. It had been here since the first day she walked in. She just hadn't needed it until now. The file was in Ashworth's office by 6 o'clock. Mara sat across from his desk in the same chair as before, the one that was slightly lower than his. A detail that had stopped mattering and read through every page while Rourke waited in the corridor outside, and the building around them settled into its evening rhythm. Ashworth had left the room without being asked, which she appreciated. He was learning. The file was 41 pages. The first 9 were her legitimate employment documents application credentials, the nursing license that was real and valid, and told only the fraction of the story she'd chosen to show. The next 32 pages were Hale, write-ups, incident reports, deviation logs, complaints filed through the formal process, complaints filed informally as notes to Patrice, complaints CC'd to Ashworth that had apparently been filed and never acted upon. 8 months of paper, methodically constructed, each document following the same pattern. A clinical event, Mara's involvement, Hale's characterization of that involvement as an overreach or an error, a recommendation for corrective action that had mostly resulted in her being assigned progressively lower acuity patients until she was effectively sidelined. She read every page. She didn't rush. She made 3 notes on a legal pad she'd found on Ashworth's desk. When she was finished, she set the file down and looked at her notes. The first note said, Dennis Farrow, 21, 14 cardioversion documented, patient outcome positive, write-up filed within 12 hours. The second said, Raymond Kowalski tourniquet repositioned, hemorrhage controlled, patient survived, write-up filed same day, no mention of outcome. The third said Hale's OR credit list Q3. That third one she looked at for a moment. Then she put the legal pad in the folder, picked up the folder, and went to find Ashworth. He was in the hallway, talking to Patrice in a low voice that stopped when Mara came through the door. She handed him the folder. The Kowalski write-up omits the clinical outcome, she said. It documents my actions as an unauthorized intervention, but doesn't note that the patient's hemorrhage was controlled before OR transfer, or that the tourniquet I repositioned was the reason his femoral output slowed. That's incomplete documentation. Ashworth took the folder. Incomplete. Or also look at his OR credit log from the 3rd quarter, she said. Specifically the procedure notes on 2 cases from August, a ruptured spleen and a hepatic laceration. Compare the procedure descriptions to the nursing notes from those shifts. She paused. I wrote those nursing notes. Patrice went very still. Mara looked at her. He didn't perform those procedures the way he documented them. I was in the room. The nursing notes reflect what actually happened. She kept her voice level. I'm not making an allegation. I'm telling you where to look. She left them with the folder and walked back to the surgical floor. Rourke was outside Ferris's room. They'd moved him from OR recovery to a monitored room on the surgical floor, standard post-operative placement. One of Rourke's soldiers was on the door. Through the window, Mara could see Veld making notes on the bedside chart, his manner unhurried, which was the best possible sign. Soren, she said through the doorway. Veld looked up. Stable. Pressure's been holding at 110/70 for the last hour. I've got him on a norepinephrine drip, low dose, trending down as he warms up. Chest tube output is normal, no reaccumulation. He paused. Good surgery. You said that already. Still true. He went back to his notes. She went in and stood at the bedside. Ferris was sedated, but not deeply. The anesthesia was lightening by design, and she could see the first signs of it in the small movements of his face, the slight tension in his jaw. He'd be conscious within the hour. She checked his peripheral pulses manually, femoral, popliteal, dorsalis pittis, all present, bilaterally confirmed the chest tube wasn't kinked, looked at the drain output, and straightened up. Rourke had come in behind her. He's going to need at least 72 hours before transport, she said. I know. And the transport team needs to understand the repair. I used a synthetic graft, Dacron, standard for the segment. They need to know the proximal and distal clamp positions and the suture lines so the receiving surgeon isn't working blind. I'll make sure your notes transfer. She nodded. She looked at Ferris for another moment, the young face, the weathered edges of it, and then looked at Rourke. How did he get hit? Rourke was quiet for a second. Training exercise, fragment from an incomplete detonation. Wrong place, wrong angle. He paused. He's very good at his job, just not at predicting physics. Nobody is, she said. She pulled a chair to the bedside, not because she needed to sit, but because she'd been standing for 6 hours, and the surgery had taken more out of her than she'd let herself acknowledge while it was happening. She sat, checked Ferris's monitor one more time, and let herself be still for a moment. Rourke stayed in the doorway. He'd always known when not to fill silence with something unnecessary. The document you brought, she said. The commendation. Why 6 months ago? Because that's when the review board finalized your service record. She looked at him. Which review board? The one that was supposed to happen before you left, he said, and didn't, because of the circumstances. She knew which circumstances. She didn't say so. The record is fully unclassified now, Rourke said. Not the operational details, but the credentials, the training, the outcome data from your cases, all of it is on file with the Idaho Medical Board, has been for 4 months. We submitted it. He paused. We were trying to do something right, Major. After the fact, but still. She absorbed this. You submitted my surgical credentials to the state board without telling me. We notified your registered address. He looked at her steadily, which was a P.O. box in Meridian that you hadn't checked in 3 months. She pressed her lips together. That was fair, technically. She'd been avoiding things. The license came through automatically, Rourke said. You've had an active Idaho surgical license for 93 days. She sat with that for a moment. The thing she'd been walking around without, the credentials she'd thought she'd left behind with everything else, had apparently followed her here through the mail she hadn't been reading. She didn't know whether to laugh at the absurdity of it or feel the particular shame of someone who'd been so committed to disappearing that they'd made themselves smaller than they needed to be. She chose neither. So Hale's argument that you performed surgery without hospital privileges is technically still accurate, Rourke said. But with an active state surgical license and federal medical authority on the table, it becomes a very different kind of argument. The kind that's very difficult to make in front of a medical board. She stood. I want to file a formal complaint tonight. Not tomorrow, tonight. Rourke looked at her, against Hale. Against the documentation practices in this department for the last 8 months. She pulled her jacket from the chair back. Hale's behavior is a symptom. What's underneath it is what needs to be addressed. He nodded slowly. He'd always respected that about her, the way she saw the larger problem without losing the specific one. I'll get you what you need from our side, he said. She was already moving toward the door. The nursing station on the surgical floor was quiet. At 8 in the evening, the day shift long gone, the night staff settled into their rhythm. Brenda Okafor was still there. Mara had expected her to be gone, but she was at the station with a stack of printed documents in front of her, and the expression of someone who'd made a decision and was committed to it. Mara stopped at the counter. Brenda pushed the stack toward her without preamble. Every incident report filed in the surgical department in the last 12 months, she said. Nursing administration has access to the full database. I pulled everything. Mara looked at the stack. It was substantial. Specifically, Brenda said, and her voice was different now, quieter, more careful. The performance of it stripped out look at the August reports. And the September ones. There are 6 nursing notes in the OR logs that have been altered in the physician's addenda. The original timestamps don't match the amendment timestamps. She paused. Someone changed them after the fact. Mara looked at her. How long have you known? Brenda held her gaze. I noticed it in September. I didn't. She stopped, started again. I told myself it was a documentation error, because that was easier. A beat. 2. I also said things about you, Brenda said, in the first weeks when you started. I said things that were... She stopped again. This was not a woman who apologized easily. Mara could see that. The words were costing her something. I was wrong. I don't expect you to. I know, Mara said. She picked up the stack of documents. Thank you for these. She left the counter. She didn't tell Brenda she was forgiven, because that wasn't what Brenda needed. What Brenda needed was to be taken seriously, and the way to do that was to use what she'd brought to the right purpose. Gerald Ashworth spent 2 hours in his office that night, reading the documents that landed on his desk in sequence: my notes, the incident report stack, the OR credit log, and a formal written statement from Rourke that laid out the federal credentialing situation in language that was precise and unarguable. At 10:17, he called the hospital's legal counsel, not the woman who'd accompanied Hale, a different one, from a different firm, the one the hospital kept for internal matters rather than physician defense. The call lasted 40 minutes. At 11, he called the chairman of the hospital's medical executive committee and asked for an emergency session in the morning. At 11:30, he called security and asked them to restrict Dr. Victor Hale's access to the OR scheduling system pending administrative review. He did not call Hale. He went home, sat in his kitchen for a while, and thought about the 30 years of hospital administration he'd done and the number of times a situation like this had resolved itself the way he'd hoped it would. Not many was the answer, but sometimes. Mara was in the family waiting room on the 2nd floor at midnight, the one that was always empty at this hour, with its stiff upholstered chairs and a television mounted in the corner that someone had muted and left on a weather channel when her phone buzzed. Unknown number, she answered. Major Bennett. The voice was female, measured with the particular cadence of someone reading from prepared notes. This is Lieutenant Colonel Dana Whitfield, Judge Advocate General's Corps. Colonel Rourke asked me to reach out regarding the formal complaint you're filing. I want to walk you through the jurisdictional framework so you understand what's actionable under federal versus state versus hospital administrative authority. Mara leaned back in the chair. All right, the operative procedure today falls under federal medical jurisdiction. That piece is clean. No hospital can discipline a physician acting under federal authority in an emergency. That's settled case law. A pause, papers shuffling. The 8 months of prior conduct is the more complex piece, because you were employed as a nurse, not a physician. The scope of practice violations Hale alleged were technically violations you held a nursing license at the time, not a surgical one. I know, however. Whitfield's voice shifted slightly. The surgical license being active for the last 93 days changes the calculus on the more recent incidents. The ferrocardioversion and the Kowalski hemorrhage control both occurred within that window. Mara sat forward. She hadn't run the dates herself. She did it now, quickly in her head. The Farrow case was 11 days ago.
Yes.
At which point you held an active, unrestricted Idaho medical license that authorized you to perform those interventions. The write-ups Hale filed against you for those specific incidents are therefore not scope of practice violations. There's something else. Harassment, Mara said. At minimum, Whitfield said. Depending on what the altered OR documentation shows, potentially something more. Another pause. I'll be in Boise tomorrow morning. I'd like to meet before the medical executive committee session. What time? 7. I'll be there. She hung up and sat for a moment in the empty waiting room. The muted weather channel showed a satellite image of Idaho. The cold front that had caused the ice on the interstate 48 hours ago had moved on, replaced by a band of clear air coming in from the west. Tomorrow would be cold and bright. She got up, checked on Ferris one more time, stable, his monitor quiet and regular. One of Rourke's soldiers still on the door, and went to find somewhere to sleep for 5 hours. She was back at 7. Whitfield was already in the building, a compact woman in her 40s with a JAG uniform and a briefcase that she carried like it had weight in it. They sat in a conference room on the administrative floor, and went through everything methodically: the documentation, the timeline, the federal credential submission, the altered OR notes, and by 8:15 they had a coherent picture. At 8:30, the medical executive committee convened in the boardroom 2 doors down. Mara was not in the room. She was in the corridor with Rourke, waiting. Hale was in the room. She'd seen him arrive. He'd walked past her in the hallway without making eye contact, his legal counsel beside him, his posture carrying the residual authority of a man who'd spent 3 decades being the most important person in every room he entered. He'd looked, briefly, at the door of the boardroom, like he was measuring it. Rourke stood beside her with his arms folded and said nothing. 20 minutes into the session, Ashworth came to the door and called her in. The boardroom held 8 people: Ashworth, Patrice, the committee chairman, a cardiologist named Dr. James Reyes, who ran these sessions with the particular exhausted patience of someone performing a difficult civic duty, 2 other department heads, Whitfield, Hale, and Hale's counsel. Mara took the seat across from Hale. She'd asked for the original OR logs from August and September to be on the table, and they were printed, organized, the amendment timestamps highlighted in yellow by whoever had prepared the room. Reyes ran the session efficiently. He outlined the agenda, the formal complaint regarding the altered documentation, the credential status of Mara Bennett, and the conduct allegations against Dr. Hale arising from both. He did not editorialize. He just laid it out, one piece at a time, the way a process was supposed to work when it was working correctly. Hale's counsel tried twice to redirect first to the scope of practice argument, which Whitfield addressed in a single paragraph of clean legal language that left no purchase, and second to the question of whether Mara's federal license submission constituted proper disclosure to the hospital, which Ashworth addressed by noting that the hospital had received no disclosure because Mara had not known the submission had been made. That exchange took 4 minutes and went nowhere Hale wanted it to go. The altered documentation took longer. Reyes walked through the August cases one by one. He asked Hale direct questions about the procedure notes, specific questions, the kind that required specific answers. Hale answered carefully, choosing language that was technically defensible, but increasingly constrained by the timestamps which didn't lie, and by the nursing notes which also didn't lie, and by the fact that Mara was sitting across the table and had been in those OR rooms, and could be asked the same questions with the same specificity. Reyes didn't ask her. Not yet, he didn't need to, which she understood was itself a signal the record was doing the work without her having to carry it. At one point, during the third case review, Hale's counsel leaned toward him and said something in a low voice. Hale listened, his jaw moved. He said something back. Then he went very still. That stillness, Mara had seen it before. She'd seen it in people at the moment they understood that the structure they'd been defending had already given way somewhere they couldn't see, and they were standing on it anyway. Reyes set down the third case file and looked at Hale over his glasses. Dr. Hale, the amendment timestamps on the procedure notes in these 3 cases are between 4 and 11 days after the original documentation. Can you explain the clinical rationale for amending procedure descriptions that far after the event? A long pause. Addenda are sometimes necessary for completeness, Hale said. These are not addenda, Reyes said. These are replacements. The original text was overwritten. He waited. Were you aware of that when you made the changes? Another pause. I would need to review the specific documents are in front of you, Reyes said. Hale looked at the documents. He didn't pick them up. Mara kept her eyes on Reyes, not on Hale. She'd learned long ago that watching someone arrive at their consequences was not the same as satisfaction, and she didn't want to confuse the two. The session continued for another 40 minutes. By the end, Reyes had a full record time-stamped, documented, witnessed that the committee could act on. He closed the session formally, thanked the parties, and said that the committee's determination would be communicated in writing within 24 hours. In the meantime, and here he looked at Ashworth, who nodded Dr. Hale's surgical privileges were suspended pending the formal determination. Hale's counsel stood immediately. That's a premature action before. It's a standard protective measure during an active investigation, Reyes said mildly. Standard for any credentialing concern of this nature. Dr. Hale is welcome to appeal through the established process. He removed his glasses. That will be all. The corridor outside the boardroom felt like the aftermath of something. Whitfield left immediately. She had a flight to catch and had given Mara her card and told her to call if the jag angle complicated anything, which Mara had a feeling it wouldn't. Ashworth stood near the elevator, looking like a man processing a difficult morning. Patrice was already on her phone. presumably managing whatever cascading administrative consequences were following from the session. Hale came out of the boardroom last. His counsel was saying something to him, brisk, professional, already pivoting to the next step. Hale was listening, but his eyes had gone somewhere that wasn't the conversation he was in. He looked, for the first time since she'd known him, like a man whose dimensions had changed. Not smaller exactly. More like a building after the internal load-bearing structure shifts same facade but different. He saw her. He stopped. His counsel kept talking for a moment, then stopped too. The corridor was empty, except for the four of them. Rourke was somewhere further down, giving her room. The overhead lights were the ordinary fluorescent lights of a hospital administrative floor, doing nothing cinematic, providing nothing dramatic. Just a hallway. Just two people at the end of a long morning. Hale looked at her. There was something working in his face, not remorse, she didn't think. Not yet, maybe not ever, but something in the neighborhood of recognition. The particular look of a man revising his understanding of what had happened and not liking the revision. He opened his mouth. She said, "Don't." He closed it. She walked past him toward the elevator. Ferris was awake at 10 in the morning. Not fully still sedated enough to be quiet. The anesthesia tapering on Veld's careful schedule, but his eyes were open and tracking. And when Mara came into the room, he found her face with the same focused attention he'd had in the lobby, except now there was more of him behind it. "How do you feel?" she said. Not quite a question. He thought about it. His voice came out rough and thin, the way voices did after intubation. "Like someone hit me with a car. Fragment," she said. "From a detonation." "Right." He looked at the ceiling. "I remember the field. Not much after." "That's normal." He was quiet for a moment. "Did you?" He stopped. "Try it again." Colonel Rourke said, "You operated." "Yes." He said, "You fixed the aorta." "That's accurate." He turned his head toward her. The movement was slow. Careful, he'd figure out quickly how to move and how not to. "Thank you," he said. She looked at him. 29 years old. Whatever he'd done in the years that had put him in this bed, he'd done it with the same commitment she recognized in herself from a distance, the choice to put the body between something and the people it would otherwise reach. She didn't think he was reckless. She thought he was precise, and that precision had run into physics, which was the one thing precision couldn't fully account for. "Don't do it again," she said. He almost smiled. "Yes, ma'am." She checked his pulse, confirmed the drain output was continuing to decline appropriately, made a note on the chart, and was leaving when he spoke again. "What are you?" he said, actually. "I heard the nurses out there are saying stuff. About what happened." She stopped at the door. "I'm a surgeon," she said. "I've been working as a nurse here for the last 8 months. A pause. Why, she thought about the honest answer to that. Not the tactical answer, not the institutional answer, but the actual one. "I needed to stop for a while," she said. This was supposed to be stopping. He was quiet. Then did it work? She looked at the floor for a moment, then at him. "No," she said. "Not really." She left him with that and went back into the hallway. Rourke was waiting outside, and his expression told her before he said anything that something had changed in the last 30 minutes. He had his phone in his hand, the screen up. "What?" she said. "Hale's counsel just filed an emergency motion to the hospital board," he said. "They're claiming the committee session this morning was procedurally improper. They want the privilege suspension reversed." He paused. "They're also claiming that the federal credential submissions was made without your knowledge or consent, which makes the surgical license itself potentially contestable." She stared at him. "They're going after the license." "It's a reach," Rourke said. "Whitfield says it won't hold, but it creates a delay, and during that delay, Hale's team will push for reinstatement." She looked at the floor. She thought about the 41 pages in Ashworth's folder. She thought about Brenda's stack of incident reports with the mismatched timestamps. She thought about the 2 cases from August, the procedures Hale had documented as his own, and the nursing notes that told a different version. She thought about the thing she hadn't yet used. The piece she'd been keeping back, not because she was strategic about it, but because she'd hoped it wouldn't be necessary. "Rourke," she said. "The 2 August cases. The ones with the altered notes. What about them?" She looked up at him. "I have the original procedure documentation, not the hospital copy.
Mine.
I kept my own records not as evidence, just as," she paused. "Habit. From deployment. You document everything, because the record is the only thing that survives when everything else doesn't." Rourke went still. "I have contemporaneous notes," she said. "Dated, time-stamped on my personal device. They predate Hale's amendments by weeks." She held his gaze. "If the board is going to argue about the license timeline, The documentation I have would establish that my clinical judgment was operating at a surgical level for the entirety of those 8 months, which means Hale knew what he was looking at. And he still filed those write-ups. Rourke was quiet for a moment. That changes the administrative complaint into something with more teeth. Yes, she said. He looked at her for a long moment. You've had that this whole time. Yes. Why didn't you? Because I came here to stop, she said. Not to fight. She looked down the corridor toward Ferris's room, toward the OR wing, toward the administrative floor, toward all of it. But I'm done stopping. She took out her phone. She pulled up the notes, 8 months of them, organized by date, by case, by intervention. Every clinical decision she'd made in this building, documented in the shorthand she'd developed in operating theaters, in places this hospital couldn't imagine. She was about to hand it to Rourke when his phone rang. He looked at it. Something shifted in his face, not alarm exactly, but the particular attention of someone who'd trained themselves not to react to bad news until they had the full shape of it. He answered, listened, said 3 words. How long ago? He hung up. What? She said. He looked at her. Hale's counsel filed the motion to the board 10 minutes ago, he said. Simultaneously, someone we don't know who yet sent an anonymous tip to the Idaho Medical Licensing Board. The tip claims that your federal credential submission contained falsified deployment records. The corridor was very quiet. That's not true, she said. I know it's not true, Rourke said. But the board has to investigate any formal complaint, which means your surgical license is under active review as of 20 minutes ago. He held her gaze. Which means the surgery you performed this morning is under review as well, she said. He didn't answer, because the answer was in what he'd just said, and they both knew it. She stood in the hallway of Redwood Valley Medical Center and understood that someone had moved faster than she had, and had aimed not at the complaint or the committee session, or even the documentation, but at her, specifically, at the foundation of everything she'd just established, and had done it with the particular cruelty of someone who understood exactly which wall, if you knocked it out, would bring the rest down. She looked at Rourke. Who has access to my federal records? Limited, he said. Very limited. Narrow it down. He was already looking at his phone, already making the call, already moving, because this was what Rourke did when the situation moved faster than the plan. He moved with it. She'd always been able to count on that. But as he stepped away to make the call, she looked down at the phone, in her own hand, the notes, the 8 months of documentation, the record she'd kept out of habit from a life she'd tried to leave behind, and understood that whoever had sent that tip knew her well enough to know which license mattered, which record was the keystone, and exactly how to pull it, and the number of people who knew her that well fit on one hand. She made the list in her head before Rourke finished his call. People who knew her federal record well enough to identify the credential submission as the keystone, Rourke himself, which she eliminated immediately. The 2 JAG officers who'd processed the unclassification review, both of whom were at Fort Meade and had no connection to Boise. The commanding general who'd signed the commendation, who was currently in Germany, and had approximately 0 motivation to undermine a document bearing his own signature. That was the short list. The people with operational knowledge. The longer list, the people who knew her well enough to understand which wall to knock out, was different. That list was about pattern recognition, about knowing how she thought, how she'd built things, what she'd lean on if she needed to defend herself. That list required proximity, recent proximity. She'd been in Boise for 8 months. She'd spoken to almost no one from her previous life. Almost. Rourke came back from his call. He had the look she'd learned to read over years of working alongside him, the controlled expression of a man who'd received information he didn't like and was sorting it into actionable and non-actionable before he opened his mouth. The tip was filed through the board's anonymous complaint portal, he said. Digital submission routed through a VPN. JAG is working on the technical trace, but it'll take time. What was in it? She said. Specifically, it claimed that your deployment records from the 3rd and 4th tour were falsified. Specifically, the surgical outcome data, the case numbers, the survival rates. He paused. It used language that indicated familiarity with how those records are structured. Not a civilian guessing at military documentation. Someone who'd seen the format. She looked at him. Who reviewed my unclassification file before it was finalized? Whitfield's office processed it. 2 JAG attorneys, 1 paralegal. He held her gaze. And the review board itself, 3 members, all 06 and above. I can get you the names in 20 minutes. Do that, she said. But also look at who else was in the loop. Not the primary reviewers. The adjacents who prepared the case summary, who formatted the credential submission for the state board, who handled the physical paperwork. Rourke was already typing. He had a staff officer who managed exactly this kind of administrative reconstruction, a detail-oriented captain named Tillis, who Mara had met once and immediately respected for the specific reason that he never made eye contact until he was certain of what he was saying. She left Rourke in the corridor and went to find Ashworth. Ashworth was in his office. He'd been there since the boardroom session ended, and his desk had accumulated the specific archaeology of a man working a problem, multiple files open, 2 coffee cups, a legal pad with half a page of notes in handwriting that had gotten smaller and more compressed as the morning went on. He looked up when she came in and didn't make her ask. "I heard about the licensing board complaint," he said. "I need you to do something," she said. "Not as a favor. As the person responsible for the integrity of clinical documentation in this institution." He put his pen down. "All right. I need you to formally request a hold on Hale's personnel file. Not a review, a hold. Nothing leaves, nothing gets amended, nothing gets added, as of this moment." She looked at him. Because if someone is trying to destabilize the credential argument, the next logical move is to clean up the documentation trail here. Whatever's in his file right now needs to stay exactly as it is. Ashworth stared at her. I think his counsel is very good at their job," she said. "And very good at their job means anticipating what the other side will use and reducing it where possible." She paused. "The altered or notes. The incident report timestamps. Those are currently in the file. I need them to stay there." He reached for his phone. He called records management, and she listened while he placed the hold in language that was formal and clear and didn't leave room for interpretation. When he hung up, he looked at her with the expression of a man who'd spent 30 years managing institutions and was now experiencing the particular discomfort of realizing the institution he'd been managing had a problem he'd been too close to see. "The board chairman called me," he said, Reyes. "He wants a full audit of Hale's OR documentation going back 2 years, not just the August cases." "That's the right call," she said. "It's going to be disruptive." "Yes," she said. "That's how audits work." He was quiet for a moment. "For what it's worth," he said, "I should have looked more carefully at your file when you first started. The federal flag should have prompted a conversation, not just a hold in the drawer." She looked at him. He meant it. She could see that. "You weren't wrong to be cautious," she said. "You just could have been curious at the same time." She left him to his phone calls. The trace on the anonymous tip came back faster than Rourke had expected, not because the VPN was cracked, which it wasn't, but because Captain Tillis, working the administrative reconstruction Rourke had requested, found something in the paperwork trail that didn't require breaking encryption. Rourke called her at 11:40. She was in the family waiting room again, the empty one, with her phone and her own notes, and the particular quiet of a space that was designed to hold difficult waiting, and therefore absorbed it well. "The credential submission to the Idaho Medical Board," Rourke said. "When we prepared the packet, we sent it to a specific licensing liaison at the board's standard procedure, expedited review channel for military medical personnel." A pause. "That liaison's name is on the submission cover sheet. Public record." "Okay," she said. "The anonymous tip was filed to the board's complaint portal at 9:14 this morning," Rourke said. "The medical executive committee session in the boardroom started at 8:30. The complaint was filed 44 minutes into the session." She sat forward. "Someone who knew the session was happening and knew it was going badly for Hale," Rourke said, "which narrows the field to people in that boardroom, people with access to someone in that boardroom, or someone monitoring the building," she said. "Hale's counsel had a paralegal in the lobby," Rourke said. "She was on her laptop the entire session. Hale's counsel was passing notes out through the boardroom door twice. We have it on the lobby camera." Mara was quiet for a moment. "So the complaint wasn't filed by someone in my military record. It was filed by someone who knew the submission existed, which is in the cover sheet, public record, and knew enough about military documentation format to write a complaint that sounded credible. Which means it was drafted in advance," Rourke said. "Before the session. The paralegal just waited for the signal. They planned for the session to go wrong," Mara said. "For Hale. They had a contingency," "Yes," Rourke said. "The complaint itself may not hold. Whitfield thinks it's thin. The language is credible on the surface, but the specific allegations aren't verifiable because the actual records are classified. The board will open the inquiry, find nothing actionable, and close it. But that process takes 60 to 90 days, during which my license is under review, and during which Hale's team will argue that the committee's determination should be paused pending resolution." He paused. "It's a delay tactic." "A good one." She thought about that for a moment. 60 to 90 days. The committee determination sitting in suspension. Hale's privileges restored in the interim while the review ground forward. The altered OR notes sitting in the file. The incident report sitting in the file. Everything waiting for a process that moved at institutional speed while Hale's counsel moved at legal speed. She thought about what she had that moved faster than either. The personal notes, she said. I was going to say that, Rourke said. If I submit them to the board directly, not through the hospital, directly, as a responding party to the complaint, they go into the inquiry record. Timestamped from my device, which predates the license complaint by 8 months. The board's inquiry has to address them as part of the record. She paused. It doesn't accelerate the timeline, but it changes what the inquiry finds when it finishes. It also, Rourke said carefully, demonstrates that you were practicing at a surgical level throughout your employment here, which is a different conversation than the one Hale's team wants to have. It's the conversation that needs to happen, she said. She hung up and looked at her phone for a moment. 8 months of notes. She scrolled through them, not reading, just confirming they were there, which she already knew, but needed to verify the way you verify a not before you trust it with weight. Dates, times, case notations, clinical decisions and their rationale, procedure descriptions in the shorthand she'd developed overseas that was precise and unambiguous and entirely her own. She opened her email. She drafted a message to the Idaho Medical Licensing Board's inquiry officer, whose name and contact information were on the board's public website, and attached the notes as a single PDF, all 8 months, in chronological order, with a cover letter that was 2 paragraphs long and said exactly what needed to be said and nothing extra. She sent it at 12:03 p.m. The afternoon was the kind that accumulated quietly and then revealed itself all at once. At 1 o'clock, Brenda Okafor delivered a supplementary stack of documents to Ashworth's office. She'd gone back into the incident report database and pulled the full 2-year history, not just the 12 months she'd initially provided, and what the second year contained was worse than the first. 3 additional cases with amended procedure notes. 2 nursing staff write-ups filed under Hale's name that the nurses themselves had never been informed of. The write-ups had been filed to their personnel records without the standard notification process, which was not only procedurally improper but potentially a violation of the hospital's own HR policy. Ashworth forwarded the supplementary documents to Reyes's office at 1:15. Reyes called him back at 1:40 and used the word systemic twice in the first 3 sentences. At 2 o'clock, one of Hale's former surgical residents, a 3rd-year named Dr. Priya Anand, currently doing a rotation at a hospital in Twin Falls, called Patrice Doyle's office. She said she'd heard through the medical community grapevine that an audit was underway. She said she wanted to make a statement. She said she'd been present for one of the August cases, and that the procedure had not gone the way Hale's notes described, and that she'd known it at the time and had said nothing because she was a resident, and Hale controlled her evaluation scores. Patrice sent her directly to Reyes. At 2:30, Hale's counsel filed a formal objection to the personnel file hold Ashworth had placed, arguing it constituted an improper restraint on Dr. Hale's ability to manage his own professional documentation. The objection went to the hospital's legal team. The hospital's legal team spent 11 minutes reviewing it and sent back a response citing 3 separate provisions of the hospital's internal credentialing policy under which the hold was fully authorized. The objection went nowhere. Mara learned all of this in pieces from Rourke, from Patrice, from Ashworth himself, who had apparently decided that the most useful thing he could do at this point was keep her informed and not attempt to manage the information. She was in the corridor outside Ferris's room for most of the afternoon, close enough to check in on his recovery, which was progressing the way a solid vascular repair progressed when the patient was young and otherwise healthy faster than expected, with complications that were manageable rather than catastrophic. At 3 o'clock, she went in to see him. He was sitting up. Not comfortably, the chest drain made that complex but upright, which was itself a significant development. His color was markedly better. Veld had been in an hour ago and reduced the norepinephrine drip to minimal maintenance, which meant his own circulatory system was doing most of the work now. "You look better," she said. "I feel like I got hit by a truck," he said, which is an improvement from this morning. She checked his drain, his pulse, his incision site through the dressing. Everything was where it should be. She made a note on the chart. "How long before I can move?" he said. "Transport? 72 hours minimum from the time of surgery. So tomorrow evening at the earliest, more likely the day after." He absorbed this. "What's happening out there?" "I can hear things through the wall. Lot of activity, institutional processes," she said. He looked at her sideways. That sounds bad. It's necessary, she said, which is different. He was quiet for a moment. Then, Rourke told me what you gave up to be here. Before, I mean. What you left, she didn't answer. He wasn't telling me as gossip, Ferris said. I think he was explaining why he brought you a document instead of just calling. He looked at the ceiling. He feels like he owes you something. He doesn't, she said. He thinks he does. A pause. He said you left because of something that happened. On the last deployment. He glanced at her carefully, the look of someone who'd been trained to read people and was using the skill with deliberate restraint. You don't have to tell me. No, she said, I don't. She straightened the chart on the hook at the foot of his bed. Get some rest. The more you rest, the faster the fluid clears. She left before he could say anything else, which was not avoidance exactly. She simply didn't have anything to add, and she'd learned that the difference between a clean exit and a painful one was usually knowing which words were extra. At 4:15, Victor Hale walked back into the hospital. He came through the main entrance, not the staff entrance, which was a choice that read as deliberate a man using the public door, because the public door was harder to stop than the staff badge system, which Ashworth had restricted but not eliminated. He had his white coat over his arm and his counsel beside him, and the particular energy of someone who'd spent the lunch hours being advised and had come back prepared. Security intercepted him at the lobby desk. Not physically, just procedurally. The front desk coordinators stepping out to speak with him before he reached the elevators. Mara heard about it secondhand from one of the ER nurses who'd been in the lobby and had the presence of mind to text Patrice. The restriction on his OR access did not extend to the building itself, which was a gap in Ashworth's earlier instructions. The building access required a different authorization layer. Hale's counsel had apparently identified this gap, which was how they'd advised him to come through the front door. He was headed for the administrative floor. For Ashworth's office, Mara guessed, or possibly for Reyes, some version of a direct confrontation with the committee, an attempt to present his own framing of the morning's session before the written determination locked it in. She thought about this for 30 seconds. Then she walked to the elevator and pressed the button for the administrative floor. She arrived before he did. He'd been delayed at the front desk long enough that she had 90 seconds to be already in the corridor. When the elevator opened and Hale stepped out with his counsel and found her standing between him and Ashworth's office. He stopped. She said, "The board received my notes an hour ago." His counsel started to say something. Mara kept her eyes on Hale. 8 months, she said. Every case I touched, every clinical decision, every intervention. Timestamped and submitted. She watched his face. The board's inquiry is going to find a complete contemporaneous record of what happened in this building. Not the amended version. The original. Hale's jaw was tight. The board's inquiry is going to take 60 to 90 days, she said. I know. But what it finds at the end of 60 to 90 days is not the outcome your team planned for when you filed the tip this morning. She paused. The tip was a delay tactic. The notes make the delay irrelevant. The counsel stepped forward. Major Bennett, any communications regarding the pending inquiry should be directed through. I'm not communicating about the inquiry, Mara said. I'm informing Dr. Hale of a fact that's already in the public record. She looked at Hale. You should tell your counsel to adjust their approach. She moved past them. She didn't go to Ashworth's office. She'd said what she'd come to say. She pressed the elevator call button and waited. Behind her, she could hear the counsel speaking quietly to Hale. She couldn't hear the words, only the register brisk, urgent, recalibrating. The elevator arrived. She stepped in. As those doors closed, she caught one last look at Hale's face in the narrowing gap, and it was not anger she saw there now, and not the rearranging calculation she'd seen in the boardroom. It was something older and quieter than either. A man looking at the record of what he'd done and understanding perhaps for the first time that it wasn't going away. The Medical Executive Committee's written determination arrived at 5:40 p.m., faster than Reyes had indicated, which Rourke said meant the committee had convened again informally in the afternoon and reached consensus before the formal communication cycle. Ashworth called her into his office to read it. He handed her the document across his desk without preamble. It was 4 pages. She read all of it. The committee had suspended Hale's clinical privileges at Redwood Valley Medical Center, pending a full audit of his OR documentation for the preceding 24 months. The suspension was immediate and not contingent on the outcomes of the licensing board inquiry, because the grounds for the suspension were hospital-specific: the documentation irregularities, the unapproved personnel file amendments, and Dr. Anand's statement, which had been formally entered into the record that afternoon. The committee further determined that the write-ups filed against Mara Bennett for the Farrow and Kowalski incidents were procedurally improper, as both incidents had occurred during a period when she held an active Idaho medical license, and her interventions had been within her licensed scope of practice. Both write-ups were ordered removed from her personnel file. The final section noted that the committee had referred the matter of the altered procedure documentation to the Idaho Medical Board's disciplinary division, separate from the licensing inquiry for investigation of potential professional misconduct. She set the document down. The referral to the disciplinary division, she said. That's a separate track from the licensing board inquiry. Yes, Ashworth said, the inquiry is about your license. The disciplinary referral is about his conduct. He paused. The two don't interact, which meant Hale's counsel's delay tactic, the licensing inquiry, had no effect on the disciplinary track. They were parallel processes. The inquiry could run for 90 days, and at the end of 90 days it would find nothing, and the disciplinary investigation would still be running, with the OR documentation and Dr. Anand's statement and Brenda's incident report compilation already in its record. The architecture of it settled into place. Not satisfaction exactly, more like the particular clarity that came from watching a structure resolve into its correct shape. Security, she said, have they? He left the building 40 minutes ago, Ashworth said. His counsel advised him to leave voluntarily rather than be formally asked to go. He paused. I've updated the badge restriction to include full building access. As of tomorrow morning, he'll need to make an appointment to enter. She nodded. She started to stand. There's one more thing, Ashworth said. She sat back down. He reached into the folder and pulled out a single sheet, not the committee determination, something else. A memo brief from the hospital board chair. She read it in 30 seconds. The board was initiating a separate review of the nursing department's incident reporting structure, specifically the chain of authority by which reports filed by physicians against nursing staff were reviewed, and by whom. Because what the 8 months of documentation had revealed, underneath Hale's specific conduct, was a structural gap. Physician-filed complaints against nurses went to nursing administration, not to a neutral reviewer, which meant that a physician with enough institutional standing could file complaints against a nurse indefinitely with no independent check. The memo proposed establishing an independent clinical conduct review, panel physicians and nurses, and an outside neutral for any complaint involving a physician filing against a nursing staff member. She looked at Ashworth. This was your idea, Patrice's, he said. She drafted it this afternoon. He paused. She said it was overdue. Mara put the memo down. She thought about the 41 pages in Hale's write-up file. She thought about the 6 other nurses whose personnel files contained unauthorized entries they'd never been notified of. She thought about Priya Anand, a surgical resident who'd watched something wrong happen and had calculated correctly, in her situation, that speaking up would cost her more than she could afford. It's a good proposal, she said. We'll need people to push it through the governance process, Ashworth said. He was watching her with the careful look of a man making an ask he hadn't quite articulated yet. That usually takes someone with standing in the clinical community who's willing to put their name on it. She looked at him. I'm on administrative leave. We're reinstating you, he said. Full privileges backdated to the date of suspension. The committee authorized it in the same session. He held her gaze. You can decline. I want to be clear about that. You can take the determination and the record correction and walk out of here tonight, and we wouldn't have any grounds to stop you. She said nothing. But the proposal is more likely to survive governance if it has a physician advocate, he said. Someone the clinical staff knows and the board respects. He paused. You've been here 8 months. People know you. They just didn't know what they were looking at. She sat with that for a moment. The thing she'd come here for, the quiet, the stopping, the deliberate reduction of herself to something manageable, had not worked. She'd known that since the moment she'd heard the Black Hawk overhead, maybe before. Maybe since the night she'd charged a defibrillator in room 412, and the flatline had become a rhythm, and she'd stepped back and known, with a certainty that wasn't pride but was something adjacent to it, that this was what she was, and it didn't stop being what she was, because she'd changed the address on her mail. She was still thinking about what to say when Rourke knocked on the open office door. He had his phone in his hand, and the look on his face she'd seen once before, in a different country, in a different building. At the moment, a situation became something none of the planning had accounted for. I need you in the hallway, he said. Now. She looked at Ashworth. He lifted a hand slightly. Go. She went. In the corridor, Rourke turned his phone screen toward her. On it was an email forwarded through 3 accounts before it reached him, the kind of forwarding chain that was designed to obscure origin. The email was addressed to the JAG office in Washington. It was from a civilian address she didn't recognize. It contained 3 attachments. The first was a copy of her federal deployment records, the actual records, the classified ones, not the unclassified summary that had been submitted to the licensing board. Specific, complete, the kind of document that could only have come from inside the classified system. The second was a photograph. She didn't let herself look at it for more than 2 seconds, but 2 seconds was enough. It was from the last deployment, the one she hadn't talked about, the one that was the reason she'd come to Boise to stop. The third was a 3-page document she recognized immediately. She'd written it herself, 3 years ago, as an internal debrief report. It had been classified above the level that Rourke's unclassification review had touched. It had never been cleared. It was not supposed to exist outside the classified system. She looked at Rourke. Someone accessed the classified archive, he said. Not recently. This was pulled at least a month ago, based on the metadata. He paused. The email was sent to JAG at 9:07 this morning, 17 minutes before the anonymous board complaint was filed. She looked at the phone screen again, at the 3 attachments and the civilian email address and the forwarding chain that had tried to obscure its origin and hadn't quite succeeded. The email to JAG, she said. What was the accompanying message? What did the sender say they wanted? Rourke turned the phone back toward himself and read for a moment. Then he looked up. They said they wanted to make a formal allegation, he said, that you'd falsified your debrief report, that the classified document proves it. He held her gaze. They wanted JAG to open a military misconduct investigation. She looked at the far end of the corridor, at the plain institutional wall at the end of it. She thought about the debrief report, what it said, what it accurately described, and what the difference between those 2 things meant to a person who'd read it without the context of the operation it described. She thought about who could have accessed the classified archive a month ago. The same short list, the same people who knew her well enough to know which wall to knock out. Rourke, she said. The third attachment, the debrief report. She turned back to him. I need you to get me the original, the classified original, with the full access log. Every person who opened that file in the last 18 months. She paused. Because whoever sent this email made a mistake. What mistake? The report they sent, she said, is 3 pages. He waited. The original, she said, is 11. Rourke got her the access log by 7 that evening. It came through Captain Tillis, who had spent 3 hours working the classified archive request through the appropriate channels with the particular focused urgency of someone who understood that appropriate channels were not the same as slow channels if you knew which doors to push. The log was 14 pages, every access event on the debrief file for the preceding 22 months, timestamped, user-credentialed, IP addressed where applicable. Mara read it in Ashworth's office with Rourke beside her and the door closed. The file had been accessed 11 times in the normal course of its existence: standard reviews, the unclassification assessment, 2 archival transfers. All of those accounted for the first 13 pages of the log. The 14th page had 1 entry, 14 months ago. A user credential she didn't recognize immediately. But Rourke did. She could tell, by the way. His jaw shifted when he read it over her shoulder. The access had been made from a terminal inside a government contractor facility in Arlington, Virginia. The credential belonged to a civilian analyst, attached to the same command that had overseen her last deployment. The analyst's name was not one she knew directly, but the contractor facility's name she knew very well. She'd testified against them. Not publicly, not in any forum with a record she could point to. But 18 months ago, as part of her exit processing, she'd been interviewed by an inspector general investigator and asked about procurement irregularities she'd witnessed during the 3rd deployment medical supply contracts that had been billed at combat rates for equipment that had arrived late, undersupplied, and in 2 cases not at all. People had made decisions in the field with inadequate materials because someone in a facility in Arlington had been padding invoices. She'd said so, precisely and specifically, to the investigator, and had understood that her saying so would go into a record and do whatever records did when they encountered institutional resistance, which was usually very little, very slowly. She had not known that the contractor facility had retained access credentials to the classified archive. She had not known that anyone was watching her. She looked at Rourke. They knew I was here. For how long, I'm not sure, he said. But the credential access was 14 months ago, which is 2 months after your IG interview. She set the log down. She thought about the anonymous board complaint and the email to JAG and the 3-page truncation of an 11-page document, and she thought about what it meant that someone had been sitting on this for over a year and had chosen to use it now, not when she'd first arrived in Boise, not in the months of quiet that had followed, but in the 44 minutes of a medical executive committee session when it became clear that Victor Hale was losing. They were watching Hale, she said. Not just me. Rourke was quiet for a moment. Say that again. They needed Hale to be the mechanism, she said. A physician with institutional authority who was already predisposed to suppress her. They didn't create the problem, they found one that already existed and made sure it persisted. She looked at the log. If Hale had tolerated me, I would have kept my head down and eventually left. But Hale being Hale meant I was documented, marginalized, visible in a specific way. And when the Black Hawk came and everything broke open, they were ready with a contingency. Rourke looked at the ceiling for a moment, the particular expression of a man running a sequence he didn't like the shape of. If that's true, it's demonstrable, she said. The credential access timestamp, the IG interview date, the fact that the complaint and the JAG email were filed simultaneously, 17 minutes apart, within the first hour of the committee session. She paused. That's not opportunism. That's a prepared response. He pulled out his phone. I need to call someone. Call Whitfield first, she said. Because the JAG email constitutes an attempt to interfere with a federal medical credential using illegally accessed classified material. That's not a licensing board matter. That's criminal. He was already dialing. She left him to it. She went to find Brenda. Not because she needed something from her, the documentation work was done. The formal processes were in motion, and what happened next would happen in offices and hearing rooms and legal correspondence that would grind forward at its own pace, regardless of who was watching. She went because the day had been long and she was tired in the specific way that came from doing necessary things that cost something, and there was a particular kind of tired that needed a different kind of conversation than the one she'd been having. Brenda was in the break room on the surgical floor, sitting at the table with a cup of tea that had probably gone cold and a phone she was scrolling without reading. She looked up when Mara came in. Everything okay, Brenda said. Complicated, Mara said. She pulled out the chair across from her and sat, but moving in the right direction. Brenda looked at her for a moment. I've been sitting here thinking about August, she said. The day you flagged the Kowalski hemorrhage rate, and Hale called you overreaching in front of the whole team. I stood there. She wrapped both hands around her cup. I didn't say anything. I know. I've done that before. With other things. It's easier than... She stopped. I was going to say it's easier than getting involved. But that's not really what it is. It's just fear with a cleaner name. Mara looked at her. Brenda was a capable nurse. She'd known that from the beginning. The mocking in the early weeks had been performance, the kind that came from a workplace that had organized itself around a hierarchy that punished deviation from it. People did that. They found the shape of the room and fit themselves to it, because the alternative was friction, and friction was expensive. You brought me the documents, Mara said, when it mattered. That should have been easy, Brenda said. It wasn't. She looked up. That's what I keep thinking about. That it wasn't easy, and it should have been. Mara thought about that. About the distance between what should be easy and what actually was. She'd spent 7 years in environments where every decision was made under conditions that made the right call costly, and she'd come out of it believing that the difficulty of the right call didn't diminish the obligation to make it, but she'd also come to understand that most people weren't trained for the cost. They just lived their lives and tried to read the room, and sometimes the room was organized wrong, and they didn't know it until something broke it open. The proposal Patrice drafted, Mara said, the independent review panel. It's going to need people to implement it. Nurses who understand what the gap looked like from the inside. Brenda was quiet. You're asking if I'll be involved. I'm telling you it exists, Mara said. What you do with that is yours. Brenda looked at her cup for a moment. I'll think about it, she said. And then, with the specific self-awareness of someone who just caught themselves using the phrase they'd always used to defer, I mean, yes, I will. Mara stood. The tea's cold, she said. Brenda looked at it. I know. She almost smiled. Thanks. Mara went back to the corridor. The full shape of what had been built against her came clear over the next 36 hours, assembled piece by piece as Whitfield's office worked the JAG angle, and Rourke's people tracked the credential access trail, and the Idaho Medical Licensing Board's inquiry officer received, in rapid succession, Mara's personal notes, Rourke's federal documentation package, and a formal letter from the JAG office indicating that the anonymous complaint filed to the board had been made using illegally accessed classified material and was therefore inadmissible as the basis for any regulatory action. The board's inquiry officer called Mara directly on the second morning. The call lasted 6 minutes. At the end of it, the officer confirmed that the inquiry had been closed, not suspended pending further review, but closed, the complaint dismissed, the license status restored to active without restriction. The officer's voice had the careful neutrality of someone managing institutional embarrassment, which Mara appreciated for its efficiency. She thanked him and hung up. The contractor facility in Arlington had by that point become the subject of a separate federal investigation, not because of anything Mara had filed, but because Whitfield's team had escalated the credential access issue to the Inspector General's office, which had noted with what the written communication called significant concern that the same facility already had an open IG file from the procurement review 18 months prior, and that the credential access event was now part of a pattern rather than an isolated incident. Rourke told her this over the phone. She was in the hospital parking lot, leaning against a concrete pillar, watching the October sky do what it did in Idaho in the last days of the month, big and cold and very clear. "The IG file from your interview," he said. "It wasn't sitting in a drawer." "I know," she said. "It generated a secondary review 6 months ago, before we submitted the credential packet. The contractor facility had been flagged, they just hadn't been formally notified yet." She thought about the year she'd spent, assuming nothing had come of what she'd said. The way that assumption had contributed to the decision to come to Boise and reduce herself. Because if the system didn't work, there was no point maintaining a posture designed for a system that worked. "You could have told me," she said. "You weren't taking our calls." That was fair. She'd stopped taking Rourke's calls approximately 4 months before she'd arrived in Boise, because his calls meant the world she'd left still existed, and she wasn't ready to know that. "The IG action is ongoing," Rourke said. "Your testimony from 18 months ago is part of the active record. They may want a supplementary statement." "I'll give one," she said. A pause. "That's a change." "Things changed," she said. She pushed off the pillar and went back inside. The Medical Executive Committee's formal audit of Hale's OR documentation concluded 12 days after the initial suspension. It covered 26 months of records. The findings were released in a written report that ran to 61 pages, and what it described was not the behavior of a man who had made a series of isolated errors in judgment. It was the behavior of a man who had, over 2 years, systematically altered procedure notes to credit himself with clinical decisions he hadn't made, filed personnel complaints against staff who had witnessed the actual events, and leveraged his institutional authority to ensure that the version of events he documented was the version that persisted. The documented cases involved 4 other nurses besides Mara. 2 of them had left the hospital within the previous year. One had transferred internally to a department where she'd have no contact with Hale's service. One was still on the surgical floor and had, until the audit, believed the 2 write-ups in her file were legitimate. The committee referred the findings to the Idaho Medical Board's disciplinary division, the state attorney general's office, on the question of fraudulent documentation, and the hospital's insurance carrier, which had its own interest in the accuracy of procedure records it had been paying out against. Victor Hale's hospital privileges were formally and permanently revoked on the 13th day. The revocation ceremony, such as it was, consisted of Ashworth delivering a certified letter to Hale's attorney's office and simultaneously filing the revocation with the state medical board's public record. There was no moment in a hallway, no confrontation, just a letter and a filing and a name removed from the on-call schedule that Patrice updated that afternoon without annotation. Mara learned about it from Ashworth, who called her into his office and told her directly, which she appreciated. He set the file on his desk and said the words with the careful affect of someone delivering information they considered significant, which it was. She nodded. She looked at the file. She thought about the 41 pages she'd read in this same office 12 days ago, and the document she'd expected to have to fight harder to put right. "The 4 other nurses," she said. "Their files." "Being corrected," Ashworth said. "All 4. The 2 who left were reaching out directly to notify them of the corrections and to offer reinstatement for anyone who wants to return." "And Dr. Anand?" She gave a full statement to the disciplinary division last week. "Her residency evaluation scores from Hale's service have been flagged for independent review." He paused. "She also called me personally to say she's considering applying to Redwood Valley's surgical residency program next year. Apparently she likes Idaho." Mara almost smiled. "Good. Ashworth leaned back. I want to ask you something, and I want you to know that there is no pressure attached to the question. Ask. The Independent Clinical Review Panel. Patrice has been working with the governance committee to push it through. It has enough support to pass. There are people on the board who've been quietly concerned about the physician complaint structure for years. What it doesn't have yet is a clinical director. He held her gaze. Someone to chair the panel, set the protocols, make sure it has teeth instead of just language. She was quiet. Your privileges are fully restored, he said. Your record is cleaner than clean, because the write-ups are gone, and the record now reflects what you actually did here for 8 months. You could go back to the surgical floor, or you could take a staff position that's been open since the spring, or you could do neither of those things. He paused. Or you could build the thing that would have protected you, and everyone else Hale did this too, if it had existed before. She looked at the middle distance for a moment. She thought about the years she'd spent making herself small, and what it had cost her, and what it had cost the 6 people whose files had been contaminated by a man who'd understood that the structure of the place protected him. She thought about Brenda saying it should have been easy with the plain, uncomfortable honesty of someone acknowledging a failure, not as an excuse but as a fact. She thought about what she was, and what that didn't stop being, no matter what address she put on her mail. I'll chair it, she said, for 1 year. At the end of the year, the panel transitions to a permanent structure with its own governance. I'm not the institution, I'm the setup. Ashworth nodded slowly. That's more than we expected. Don't thank me yet, she said. I'm going to draft the protocols myself, and they're going to be specific enough that there's no room for the kind of interpretation that let this happen. She stood. I'll have a first draft to you by end of week. She went to the door. She stopped. She looked back at Ashworth, who was sitting with the particular expression of a man who'd managed institutions for 30 years and had just watched something happen that he wanted to remember. Gerald, she said. It was the first time she'd used his first name. He noticed she could see it. Yes, the lower chair, she said. In this office. She gestured at the chair she'd been sitting in. Raise it. It's not subtle, and it's not neutral, and it's a small thing that makes people feel less than they are before the conversation starts. He looked at the chair. He looked at her. I'll have facilities fix it today, he said. She left. Ferris was transferred on the 3rd day after surgery, as she'd anticipated a military medical transport, a C-17 configured for aeromedical evacuation, landing at the small regional airfield east of Boise that handled military traffic. The transport team was good. She reviewed the transfer documentation with them for 40 minutes in the parking lot, beside the ambulance, going through the repair specifics, the graft position, the suture lines, the post-operative course, and what to watch for in the first 72 hours of transport. The team's lead medic, a staff sergeant named Oviedo, asked the right questions. She answered them without shorthand, because the surgery had been non-standard enough that shorthand was a liability. When they were done, Oviedo shook her hand. Good surgery, Major, he said. The title sat differently now than it had in the lobby, coming from someone who was using it not as revelation but as fact. Good care, she said. Tell your receiving surgeon the proximal clamp was above the left subclavian. It's in the notes, but say it in person. Yes, ma'am. She went back inside and took the stairs up to Ferris's room, where he was being prepared for the move IVs capped, chest drain removed 2 hours earlier. A fresh dressing, the monitors unhooked, and the room reverting to the ordinary blankness of a hospital room between patients. He was dressed in a gray Army PT shirt, seated on the edge of the bed, moving with the careful economy of someone who'd already learned exactly how far he could reach without it costing him. He looked up when she came in. Transport's ready, she said. I know. He was quiet for a moment. You're staying. It wasn't a question. Rourke had presumably told him something, or he'd heard enough through the hospital walls. For a while, she said. He nodded once. He looked at his hands, large hands, the knuckles marked with the accumulated evidence of a physical life, and then looked up. The last deployment, he said. Rourke doesn't tell me things, but he has a way of not saying things that says them anyway. He paused. Whatever happened? It's why you came here. She looked at him steadily. I'm not asking, he said. I just stopped. Started differently. When I go back, if I go back, I'll remember that there are people who go out and then have to figure out what to do with what they carried back, and that it's not always. He stopped again. He was not, she could tell, a man who talked this way often. It was costing him something. It's not always clean. No, she said, it's not, but you're still here. She held his gaze. I'm still here. He stood slowly and extended his hand. She shook it. His grip was careful. He knew exactly how much pressure his repaired chest could absorb, but it was solid. The grip of someone who meant it. She walked him to the transport team in the lobby, turned him over to Oviedo with a final instruction about elevation of the head of the transport litter, and watched them load him into the ambulance with the methodical efficiency of people who did this well. Rourke was beside her on the sidewalk. The October air was sharp and clear, the kind of Boise day that came after the front had passed and the sky had nothing left to prove. "He's going to be fine," Rourke said. "Yes," she said. "He is." The ambulance pulled out. She watched it until it turned onto the main road and was gone. "I have an offer," Rourke said. He'd been building to it. She could feel it in the way he'd been standing. The particular set of his shoulders that meant he'd prepared what he was going to say and wasn't sure how it would land. "I know," she said. "I haven't said it yet." "Classified assignment," she said. "Somewhere that needs a vascular surgeon with a specific background. Short duration, significant impact. You've been holding it since the helicopter." A pause. 3 months, he said. There and back. No deployment extension clauses. She looked at the road where the ambulance had been. No. He was quiet for a moment. Not surprised, she could tell he'd prepared for both answers. "Okay," he said. "Not because I'm done," she said. "Because I started something here that needs to finish before I do anything else." She looked at him. 1 year, then we'll see. He nodded. He looked like he might say something about the years she'd spent leaving, and the year she was now choosing to stay, about what that meant or what it cost, or what he'd thought during the 8 months when she hadn't picked up her phone. He looked like he had the words for it. Somewhere. He didn't say them, he just nodded, and she understood that was its own kind of respect. "I'll be in touch," he said. "I know," she said. He went to the waiting black SUV the helicopter had gone back the previous morning, the soldiers with it, the building exhaling around their absence. He got in. The SUV pulled out and she stood on the sidewalk alone for a moment. The hospital was behind her. She could feel it, the weight of the building, its routines and its politics and its history, and underneath all of that, the work, the actual work. The part that was still, despite everything. The thing she was built for and had never managed to leave behind, even when she'd tried. She went back inside. The first meeting of the independent clinical review panel took place on a Tuesday in November, in a conference room on the 3rd floor that Ashworth had arranged to be properly set up chairs at equal height around the table, which was a small thing and not a small thing. The panel had 7 members, Mara as chair, Patrice as administrative co-lead, 2 attending physicians from departments outside surgery, 2 nursing staff representatives, one of whom was Brenda Okafor, who had said yes without the pause she'd given herself in the break room, which Mara noticed, and an outside neutral, a retired hospital administrator from a system in Portland who'd agreed to serve on a volunteer basis and brought with her 40 years of knowing exactly where institutional structures went wrong. Her name was Harriet Voss. She was 71, small, and in possession of the particular unsentimental clarity of someone who had long since stopped needing to be liked in order to be effective. Mara liked her immediately. The first meeting lasted 2 hours. They worked through the proposed protocol framework Mara had drafted, section by section, with the outside neutral asking the kind of questions that exposed assumptions Mara hadn't known she'd made, and Brenda raising the kind of practical concerns that only made sense from the floor level, and the 2 attending physicians pushing back in ways that were sometimes defensive and sometimes genuinely useful. It was not smooth. It was a room full of people with different institutional experiences, trying to build something that had to work for all of them, and that kind of building was friction by nature. Mara ran the meeting the way she'd learned to run operating rooms in difficult conditions, not by flattening the friction, but by directing it. Every disagreement toward a specific decision, every objection toward a revision, every concern toward a protocol clause that addressed it, or a record of why it didn't need to. By the end of the 2 hours, the framework had 3 sections that everyone agreed on and 4 that still had open questions. That was better than she'd expected. When the room cleared, Harriet Voss remained. She gathered her papers slowly, with the deliberateness of someone who had somewhere to be, but wasn't in a hurry to get there. "You ran that well," she said. "It's a start," Mara said. "That's all starts are." Harriet snapped her briefcase shut. The 2 physicians who pushed back on the notification timeline. "They'll come around by the 3rd meeting, once they understand the protocol protects them as much as the nursing staff." "I know," Mara said, "the nurse Okafor." Harriet looked toward the door. "She's good. She knows where the bodies are buried institutionally, and she's not afraid of it anymore." "That's valuable." "Yes," Mara said, "it is." Harriet looked at her directly. "Why are you doing this?" she said. Not challenging, genuinely asking, the question of someone who'd watched people take on institutional reform work and had learned to read which motivations lasted. Mara considered the honest answer, not the tactical one, not the one that sounded like a mission statement. Because I spent 8 months being exactly what someone decided I was allowed to be, she said. And I had the resources to survive that. Most people don't. She paused. If the structure had worked the way it was supposed to, Hale would have been stopped 2 years ago. The 4 nurses whose files he contaminated would have had their careers intact. Priya Anand would have been able to say what she witnessed without calculating what it would cost her. She looked at the empty conference table. I'm not doing this because I'm generous. I'm doing it because I know what the absence of it looks like, and I'm not willing to walk away from that just because the immediate crisis is resolved. Harriet nodded slowly. Good answer, she said. Not a comfortable one. No, Mara said, but accurate. Harriet left. Mara sat alone in the conference room for a few minutes, looking at the table, the notes, the framework draft, the calendar they'd agreed on for the next 6 meetings. 7 people in a room making something imperfect and necessary. That was what this was. That was what all of it was. When you stripped away the drama and the urgency and the high stakes and the things that got said in corridors. Imperfect and necessary. The disciplinary division of the Idaho Medical Board issued its formal findings 6 weeks after the audit concluded. Victor Hale's medical license was suspended for a period of not less than 3 years, pending the outcome of the criminal referral to the State Attorney General's office for the falsified documentation. The suspension was published in the board's public record, as all suspensions were. The Attorney General's office confirmed receipt of the referral and indicated that charges would be evaluated within the standard review period. The contractor facility in Arlington had by November been formally notified of the expanded IG investigation. 3 of its executives had retained individual counsel. The procurement contracts under review covered 4 years and 9 deployments. The process would be long, and its outcome was uncertain in the specific way of processes that moved through institutions that moved slowly, but it had started, which was a different thing than nothing, which was what Mara had believed it was for 18 months. She filed the supplementary IG statement in the 2nd week of November. It was 11 pages. She wrote it herself, without legal assistance, in the clear and specific language she used for clinical documentation, because that was the kind of language that held up longest. She described what she'd witnessed on the 3rd deployment, with the same precision she brought to an operative note, what she'd seen, when, the chain of consequence she'd observed, and what she'd concluded from it. She did not editorialize. She did not describe how it had made her feel. She described what had happened, and she trusted that what had happened was sufficient. She filed it on a Wednesday morning. She went back to work. Dennis Farrow, the patient from room 412, the one who'd grabbed her wrist in the ICU, and said, "Thank you," with the voice of someone who'd just come back from somewhere, sent a card to the hospital in the 2nd week of November. It was addressed to the nursing floor, to the nurse who saved my life, and it had made its way to Mara through Patrice, who'd left it on her desk without comment. The card was plain, the message short. He wrote that he was home, that his cardiologist had put him on a medication regimen that was apparently going well, that he'd been told what happened that night, the timeline of it, the window, what would have occurred if no one had been in that room with the right recognition and the right equipment at the right moment. I don't know how to thank someone for something that large, he wrote. So I just wanted you to know that I went home. I'm going to see my grandchildren at Thanksgiving. I thought you should know that it mattered. She read the card twice. She set it on her desk. She sat with the feeling for a moment, not the pride she'd always been suspicious of in herself, not the professional satisfaction that could calcify into self-congratulation if you weren't careful, something quieter than either. The knowledge that a specific person was alive who might not have been, and that the path from that night in room 412 to everything that followed was a direct one, and that the thing she'd thought she was leaving behind when she came to Boise was actually the thing that had made all of it possible. You couldn't put down what you were. You could only decide what you did with it. She put the card in the desk drawer and went to afternoon rounds. On her last day of the month, she drove out of Boise before sunrise and went into the foothills. Not for any particular reason she'd been sleeping poorly, the way she usually did when a lot had happened in a compressed period and her nervous system hadn't caught up with the calendar, and the cure she'd found for that, over the years, was to put herself somewhere large and quiet until the proportions realigned. The road went into the hills east of the city, past ranch land and scrub, and the occasional fence line marking the edge of something she couldn't see. She pulled off at a spot where the road widened, and there was a view of the valley below Boise, spread in the pale pre-dawn like a map of itself, the river cutting its line through the middle, the lights still on in the hospitals and the airports, and the places that never went dark. She sat on the hood of her car and watched the sky lighten by degrees. She thought about the things she'd carried into this place 8 months ago, the debrief she'd filed and believed had gone nowhere, the credentials she'd believed she'd left behind, the sense that the right response to a world that had taken too much from her was to take less space in it. She'd come here to be a floor nurse on the night shift, to be invisible, to stop. She hadn't stopped. She didn't know, sitting here with the cold coming up through the metal in the valley, lighting itself below her, whether that was strength or stubbornness or just the plain fact of what she was. Probably all three, in proportions that varied by the day. What she knew was this: the people who'd tried to make her small had required her compliance to do it. The system that had failed the 4 nurses whose files had been altered had required everyone's silence to keep failing. The structure that had protected Hale for 2 years had required people to keep performing the performance of deference to someone whose authority was built on the suppression of anyone who saw clearly. And all of it, every write-up, every mocking comment, every assigned transport run, every careful choice to stay in her lane and not make trouble had been a negotiation she'd agreed to have, until the moment she didn't. She hadn't been saving herself when she stepped forward in the trauma bay. She'd been saving Raymond Kowalski because that was what was in front of her, and it was what she knew how to do. But the act of doing the things she knew how to do without apology, without asking permission, without performing a version of herself that fit the room's expectations, had started a chain that ended with the room being rebuilt. You didn't have to intend to change things. You just had to refuse to pretend you were something less than what you were. The sun came over the eastern hills, and the valley below caught it in pieces, the river first, then the buildings, then the roads spreading out from the center in all directions, going everywhere, going nowhere specific, just out into the world that kept going, regardless of what any one person decided to do with their particular piece of it. She sat on the hood of her car in the cold and watched her city come awake. After a while, she got back in and drove down the hill. She had a panel meeting at 9, a protocol section to finalize. A surgical consult she'd agreed to cover for the attending, who was out until Thursday. A day full of ordinary difficult things, the kind that accumulated into a life if you let them, if you stopped waiting for the right conditions, and just did the work in front of you, imperfectly and completely, the way she'd always done the work that mattered most. She drove down the hill and back into the city. She understood, perhaps for the first time, in a way that held exactly where she was supposed to be. Not because anyone had put her there. Not because the outcome had been clean or fair or inevitable. Because she'd refused, at every point where it had mattered, to accept that the version of her that other people could tolerate was the only version available. That was all it had ever been. That was all it ever took.